Excited to be here. My background is in psychology, exercise science, and health promotion, and pursuing a PhD in health education sciences. So the lens I bring today is as a true health promotion programmer working in the disability field and focusing on universal design and health.
Thank you, Lindsay. Austin.
Hi, I'm Austin Nugent. I am the Disability and Health Program Coordinator with KIC, and the lens or background that I bring is a sociology and disability studies undergraduate degree, and I'm currently pursuing my master's in public administration and policy, but I have over 10 years experience educating and implementing best practices for inclusion. So I'm excited to be here today.
Thanks. And then Morgan.
And my name is Morgan Turner. I'm a Special Olympics athlete and athlete ambassador. And I'm a program education assistant for the University of Kentucky's Human Development Institute.
Awesome, thanks, Mo. And again, my name is Danielle Augustine. I'm the Disability Education Health Coach at University of Kentucky's Human Development Institute, and I am also the 2021 co-chair of the Kentucky Diabetes Network's Diabetes Prevention Action Team, which is kind of how we brought this all together. So we are going to go ahead and get started. First, we just have some general disclosure statements. Again, I already talked about the requirements for successful CE completion. None of our presenters have any financial conflicts of interest. And then we won't be speaking on behalf of any off-label use products, and we don't endorse any products as well. So the learning objectives for today we are going to identify at least 3 barriers to participation in chronic disease management programs faced by adults with disabilities, and then solutions for each of these barriers. Identify at least 3 resources related to promoting healthy eating and or physical activity for presenters with disabilities. Identify at least 3 services or organizations specific to the state of Kentucky, which can help support the inclusion of people with disabilities in health programming. Identify and use at least 2 resources related to recruitment and retention of participants with disabilities in diabetes prevention programs. And lastly, explain the 5 domains of the guideline recommendation, adaptation, including disability or the grades framework, and be able to apply them to chronic disease management and or prevention programs. So another just short disclaimer statement is that this presentation was created in collaboration between our 2 teams at NCPAD and the Kentucky Inclusive Health Collaborative. And with that, I will turn it over to Chris.
Well, thank you very much again, everybody, for having us, and very happy to be here, very happy to be partnering with you and with the Kentucky Disability and Health team. So I'll just kind of start off and give you some background and orientation to who we are at NCPAD, and it is NCPAD with a K sound. We used to be the National Center on Physical Activity and Disability, and eventually CDC, which is our funder, asked us to insert the word health into our name and focus more on broader issues, and so we kept the name NCPAD, just added the H. But NCPAD is one of the 2 national centers on disability funded by the Centers for Disease Control and the National Center on Birth Defects and Developmental Disabilities at the CDC. We're mainly an online resource, ncpad.org, as you can see there. But we work from a public health perspective to develop resources and build capacity of health promotion and public health providers to include people with disabilities. And our main sort of lean is towards programs and policies and systems and environmental changes that focus on nutrition, physical activity and access to those things, and just general healthy community design. Next slide, please. So while we are an online resource, we are physically based at the Lakeshore Foundation, which is in Birmingham, Alabama. And Lakeshore is an accessible fitness center and a Paralympic and Olympic training center, but also home to the University of Alabama, Birmingham / Lakeshore Research Collaborative that really conducts research around health and wellness for people with disabilities. So while we are in charge of, or sort of charged with, applying knowledge to the field, quote unquote, to different fields of health promotion and public health, we also have researchers within Lakeshore that kind of develop that knowledge for us that we apply. So there's a lot of elements that go along with what NCPAT does. Next slide, please. The basis of our work comes from, and the basis of why CDC funds this kind of work is the belief that individuals with disabilities are best served by public health when they are included in mainstream public health activities. So that word included or inclusion, you're going to hear a lot today. That is the ultimate goal of what we're talking about today. People with disabilities having access to mainstream health promotion and public health programs along with or alongside people without disabilities. Next slide, please. So while we at NCPAT sort of focus on a more national view of health promotion and public health capacity building, we actually do work at, we were responsible for addressing sort of a national picture, but we do work at the state and local levels here in Alabama on different initiatives and projects that, again, are focused on capacity building of various health promotion and public health sectors. In addition to that, though, the CDC funds 19 states that are disability and health programs, and they are funded to basically do what we do at a national level, but within their own state. And of course, there are different opportunities to develop interstate partnerships and national partnerships as well. But it just so happens, of course, that Kentucky is one of the funded states. And so I'm going to go ahead and let them tell you a little bit more about what they do and their background.
So our CDC Disability and Health Program is called Project CHEER, which stands for Community Health Education and Exercise Resources. And this is Kentucky's first time receiving that CDC State Disability and Health funding. We're ending our first 5-year cycle in the capacity building stage. And so it's been a really incredible opportunity to build partnerships and bridges across the field of public health for individuals with disabilities and health professionals. And as we have done that, we have focused on a broader umbrella of creating the Kentucky Inclusive Health Collaborative, which is our bigger mission and team that focuses more on establishing those resources and partnerships that can really bring people together to promote inclusion. And we focus on doing that through education of individuals within the disability community and health professionals such as yourselves, focusing on universal design and health and how to facilitate a truly inclusive health promotion program for the broadest audience. And then we also focus on empowerment. So looking at helping self-advocates and support networks and professionals and that whole bigger aspect of community engagement so we can really focus on equitable health. And we are housed at the University of Kentucky, which is the University Center for Excellence in Disabilities for the state of Kentucky as well. And we run the health team there. And so we have a lot of resources to share with you all today for localized ways that you can get into the disability community and partnerships in your areas.
26% of adults in the United States have some type of disability. And then the percentage of people living with disabilities is the highest in the South.
Yeah, so to point out, so that makes it about 1 in 4 adults in the United States experiences some form of disability, or about 61 million Americans. And when you break down the different types of disabilities or functional disabilities, there is 13.7% of adults with disabilities that experience a mobility disability, 10.8% experience a cognition or cognitive disability, which is classified as having serious difficulty concentrating, remembering, or making decisions. 6.8% experience a disability that impacts their independent living skills, so they have difficulty doing errands alone. 5.9% experience a hearing disability, 4.6% experience a vision, so blindness or low vision, and then 3.7% experience a disability that impacts their self-care. So that would be something like difficulty dressing or bathing themselves. And then this is a breakdown of the disability percentage by county in the state of Kentucky. And as you can see, the eastern part of this state experiences a higher rate of disability compared to some of the parts on the western side. Next slide, please. And then of Kentuckians with disabilities, Kentucky actually experiences a higher rate than the national average. We have 35% of adults in Kentucky who have a disability, and of those Kentuckians, 48.6% have high blood pressure, 43.3% are obese, 49% are inactive, and 36.1% smoke. And of adults with disabilities, they are 3 times more likely to have heart disease, stroke, diabetes, and cancer compared to non-disabled individuals. And in Kentucky, we spend about $5.8 billion a year on disability healthcare costs.
So here we have our 2018 CDC Disability and Health Kentucky data, and we have 4 different graphs. We have inactivity, high blood pressure, smoking, and obesity. And you see there's colors, and each colors represent, dark blue represents people with disability. Maroon is people without a disability. Light blue is people in Kentucky with a disability, and red is people in Kentucky without a disability. And you notice on each one of these graphs, people in Kentucky with a disability is always higher up. But then you also notice that dark blue, which is people with disabilities, is not too far from people in Kentucky with a disability.
So now that we've painted a good picture of why it's important to think about disability and broad programming, and also specifically to Kentucky, we want to think about the different ways that disability is viewed. And so this is our medical model of disability, and I'll let Morgan read the comic for you.
So this is our the comic strip. So you see the sign, it says Federation of Charities for the Disabled. And then you see this guy or boss says, and when we want your opinion, we'll tell you what it is.
The medical model looks at what is wrong with a person and seeks to provide treatment. So an example of this is describing all people with visual impairments or hearing impairments as disabled. The primary concern with this approach is that people with the same impairment may have very different experiences as to how it impacts their lives. So think about having a long-term ankle injury. Let's say you broke your ankle. This might prevent a professional athlete from being able to continue playing, and they would have to retire from a lucrative career. But in contrast to someone who has a desk job, they might not experience as big of an impact in their livelihood if they fail to recover from that injury. So the medical model, therefore, does not recognize the role of the environment or external factors in defining disability.
And then we have another,
Sorry, Mo, you've got a little bit of script to read on the medical model.
oh yes. Yeah, it's the medical model view disabilities as needing to be fixed. Professionals are the only hope for a cure or normality, overcoming and being normal as or are the goals. Physicians can hold the medical model of disability may hold attitudes which limits a person's potential to achieve their highest level of functioning and quality of life. Now we go to slide 16. Or wait. Okay, slide 6. So here we have another little comic strip. It has a picture of squares and then little circle people. So it says you're going to have to change to fit into the system. And the circle people say, or how about you change the system so we can all fit? And so that's like if LeBron James was considered to be the average normal size of a human being, universal design for buildings, cars, homes would be huge. And people who are currently not considered to be disabled would become disabled because we would not be able to reach door handles to get in and out of rooms, or would not be able to reach the steering wheel of a car, and etc.
The social model was developed as a response to the medical model and a way of thinking that disability is due to society's failure to respond to the needs of people with impairments. And in the social model, disability is only a social construct and dependent upon the environment that an individual is in. So you might have a disability in one environment, but not another. And the social model looks at removing barriers that restrict life choices for people with disabilities and sees disability as a socially integrated problem more than a full integration of individuals into society. It says that the way that the room is created is making a person disabled. And I love Morgan's example of LeBron James, of all of us thinking about sitting in a car, not being able to reach the pedals or the steering wheel because our average size now is no longer compatible with the way the world is built around us. The criticism of this model is because of only having a focus on societal barriers, the model does not give enough attention to the role of the individual's impairment and their disability. So thinking about an individual who might be in constant pain would limit their quality of life, even if society is fully inclusive for them. So this is why we need to think about it broader, and how do we think about it, not just the medical model or the social model. And this is a great comic that gives an example of that. And the medical model on the left side says, her impairment is the problem. They should cure her or give her prosthetics.
And then the social model says the stairs are the problem. They should build a ramp. And you notice the sign, it says, it has an arrow pointing to stairs, and it says the way in. And under it, it says everyone is welcome. Well, obviously, you're forgetting about people with disabilities that have problems with stairs.
And this is why the entire environment matters. And Crystal to that a little bit deeper.
Yeah, so, as the social model implies, it is about the environment. But when we talk about, access and inclusion, we often first think, and it's important, we first think of things like automatic doors and ramps and accessible parking and those sort of elements that we readily see every day in the environment, accessible bathrooms, for example. But really what we're talking about and what leads to inclusion is really paying attention to the entire environment, to the experience of an individual with a disability in your program. So it is the brick and mortar, sort of elements of your built environment, but also it's your, as we'll talk about, it's your information you're providing, it's how you're recruiting, it's how it's the program content and whether or not it's accessible to people with disabilities. And we're really talking about creating welcoming environments. And I think that's a key, and what do you have to do to create those environments that welcome people of all abilities into your programs. That's what we're going to focus on today. Next. And the place to start, as I kind of mentioned earlier, is sort of in what you have to do. What does, and basically that's what does the law require you to do in terms of providing access to your programs. And most of what you're required to do is covered under what is called the Americans with Disabilities Act. When we say ADA, it's not the American Diabetes Association or American Dietetic Association, it's the Americans with Disabilities Act. And essentially the ADA is a almost 31-year-old civil rights law that prohibits discrimination on the basis of disability. And it covers rules and stipulations that employers and businesses of different sizes have to do. It looks at how state and local government programs have to be accessible. It sets rules for places of public accommodation. So basically any place that's open to the public has to be accessible under the ADA. It also provides rules to access to telecommunications as well as to public transportation. And again, the ADA is the starting point. It is not, if all you're doing is covering what's required by the ADA in your program, that's not good enough. That's not inclusion. So what we're talking about is really starting with what the law says and then going beyond that and creating that truly inclusive and welcoming environment in your program.
Thanks, Chris. That's a great segue into this part of it. So, I think as Chris alluded to, really when people think of the ADA, we automatically just think of physical accessibility, like ramps and automatic doors and things of that nature, but it really does go beyond that. So some verbiage that is important that we pulled from Title II of the ADA says a public entity shall operate each service, program, or activity so that the service, program, activity, when viewed in its entirety, is readily accessible and usable by individuals with disabilities. So it's not just your physical building that people need to be able to get in and out of, but a service and program that you offer needs to be accessible from beginning to end. And it also goes on to say that policy and programming should actively work to create health equity for individuals with disabilities through inclusion, thus helping to address the disparities experienced by people with disabilities. So it's exactly what Chris had said, is it's not just a means to an end and a checkbox. It really is something that is empowering and enabling programs to be inclusive so folks can participate to the greatest extent possible. And so we do this, and one of the ways that is included in our toolkit of strategies is using universal design. So I'll let Morgan read some definitions of how we define universal design.
Thank you. So what is universal design? The design of products and environments to be able to be usable by all people to the greatest extent possible, without the need for adaptation or specialized design. And a process that enables and empowers a diverse population by improving human performance, health and wellness, and social participation.
So we have a really great comic that some of you have probably seen if you've seen me present at a KDN meeting before, but we always like to put it in here because it really does outline what universal design is. So go ahead, Mo.
All right. So we have a bunch of kids standing out front and a guy shoveling stairs. One of the kids says, could you please shovel the ramp? And the guy says, all these other kids are waiting to use the stairs. When I get through shoveling them off, then I will clear the ramp for you. And the kid quickly says, but if you shovel the ramp, we can all get in. So everybody could get in. I feel like that would be much easier if you just clear the ramp. Everybody's lives will be a little bit more easier.
So when Chris talked about the ADA, you have what would we consider accessibility. And so this is actually an image of at the University of Kentucky's the administration building. And as you can see in the image, that there is the universal sign for disability or access, but where it's in order to enter the building, you have to go around the back and actually enter by the trash cans, I believe. And so, yes, this building is ADA compliant, but in the next image, you will see a way to incorporate accessibility in a way that is dignified and respects the individuals with disabilities to enter and feel included and like they belong in a space. And this is done through what Danielle and Morgan described as universal design. And so these are just a couple examples. You have a set of stairs that also incorporates a ramp, and then you have curb cuts, which I like to tell people that I am often appreciative of curb cuts because when I'm at the grocery store, being able to push the cart down, that is an added bonus that I benefit from, even though I'm not a wheelchair user. And so that's the beauty of universal design, is incorporating design elements in a way that truly benefits everybody. And so on the next slide, we'll explain some examples of universal design features. And you may have seen some of these in your community before. Some may be fairly new concepts. So this might include automatic doors or the hand dryers in public restrooms and towel dispensers, wider entries and pathways, audible elevators and crosswalks. So when you're waiting at a crosswalk and you hear the machine say, wait, 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 curb cuts, like I mentioned, lower sinks and toilets, smooth slip resistant flooring. And then this is some other ones that we included are plain language, and we'll talk about that more later on in the presentation, as well as just providing multiple methods to share messaging and communicate information. So this might include images, videos, written text, as well as spoken text.
All right, so we're gonna give y'all a second to wake up. I know it's early, but we're gonna segue into a little activity here. So normally if we were in person, we'd be able to see each other, but we've just gotta make do with what we have in this virtual world. So Morgan, I will let you go ahead and introduce, and Morgan's gonna lead us in this activity.
All right, so this is called What Kind of Learner Are You? So through the next couple of slides, we will ask you some poll questions to see how we all learn in different scenarios. So we have a poll, but if not available, just use the chat box. If you are an auditory learner, select ear, or just put in the chat auditory. If you are a visual learner, select eye or put visual. If you are a kinesthetic learner, please select body or kinesthetic. And then if you have more than one, please select more than one. Is everyone ready? Let's do it.
So, and our team will participate as well.
Okay, so the first one. If I have to learn how to do something, I learn best when I watch someone show me how, hear someone tell me how, or try to do it myself.
More than one. Yep, all three. Watch. Yep. I'm a kinesthetic learner for sure. Great. All right. So we'll go
Like that Laura and Brian said, all three.
Yep.
Yep.
Love it. So we'll go through a couple examples here, but just kind of try to remember, maybe if you said one type for one scenario, maybe you don't have the same answer for another one. So keep moving forward.
When I read, I often find that I visualize and picture what I am reading in my mind's eye, read out loud, or hear the words inside my head, or fidget and try to feel the content.
I'm a visual gal for sure. Yep. There's some good points in the chat. It just depends on what you're doing. Yep.
Definitely.
Read out loud. Yep. Mhm. Great.
And then,
Sorry.
well, you're good. If I had to remember a list of items, I would remember it best if I wrote them down, said them over and over to myself, or move around and use my fingers to name each item.
Ooh. Yep.
Hmm.
I need a list.
Yeah, me too.
Mhm.
I feel like if I say them over and over again, if I do it long enough, I'll say something that's not on my list or forget to say something on my list.
Right. Great. Yep. People are agreeing with you, Mo. Right.
When solving a problem, I write or draw diagrams to see it, talk myself through it, use my entire body to move objects to help me think.
Auditory person. Mhm.
Well, and then, yeah, I guess I would be all three.
Mhm.
And now I can't do all the hands.
I know, I was
One arm
trying
is
to,
short.
I was like, I can't do all three.
And I'm noticing something in the chat, just something for you all. If right above where you can type, it says 2. If you change that to say panelists and attendees, everybody can see your answers. If it just says panelists, it'll just be us 6 that can see it, which is fine if that's what you intended. But if you do want to engage with a larger group, feel free to change that to all panelists and attendees. All right.
So did everyone have the same, was everybody the same learner? And did everybody have different, were they different learners on each one? Yes, all three different.
Yep.
Yeah, so that just shows that everyone's a different learner, and that's okay. There's nothing wrong with that at all.
Mhm. And so when we think about how this applies to universal design, you know, even us, you know, as just general human beings, we learn differently in every situation. So, you know, using that concept of it wouldn't make sense for something to be presented only one way for every activity and situation, because we all learn differently across the board. So why would we expect resources and programs to be offered in only one way? It just doesn't accommodate to the broader audience, whether people have a disability or not. So that brings us to our definition of inclusion, which I'll let Chris speak on.
Yeah, so, you know, and I mentioned this a couple times already, and this is the goal of what we're hoping to empower you to be able to do is create inclusive programs. But at NCPAD, and there are various definitions, varied definitions of what inclusion is, but at NCPAD and other partners, we use a definition that basically says that inclusion means to transform communities based on social justice principles. So the idea of a fair interaction between an individual and their community, but in which all community members are presumed competent. So people with disabilities can participate, can contribute, can learn different concepts and absorb information. People with disabilities are recruited and welcomed as, and all people are recruited and welcomed as valued members of their community. They fully participate and learn with their peers and experience reciprocal social relationships like friendships or maybe professional connections. That's kind of what we're talking about when we talk about an inclusion and what an inclusive experience is about. This is what we are aiming to create for all of participants in our programs.
And so in keeping with our universal design, we wanted to show a visual to go along with all that great info that Chris just said. So this is, I think, something really impactful that helps people understand what true inclusion means. So we'll start at the bottom left here. You can see that exclusion is going to be shown as all of the green dots, which you can think of any quote unquote normal population, the general adult population. And then all of the colored dots on the outside can be any minority group, people with disabilities, people who are minorities in racial and ethnic groups, members of the LGBTQ community, any minority group you can see as the colored dots. So exclusion is no, these individuals aren't welcomed, they aren't participating with the quote unquote general population. And then we can take that a step further and we go to segregation. And this, happens a lot if let's use the playground as an example, something we like to use. So say you have a normal playground that, most parks have, but it's not accessible to children with maybe physical disabilities. So the city decides, okay, we're going to build an accessible playground, but we're going to put it across the street or on the other side of town. So in their mind's eye, they think, great, there's somewhere for these children to go that's accessible, but it's really that separation that is what limits the inclusive factor of it. And then we take a step further and go to integration. So what this might look like is if you say you work at public health department and you offer a diabetes prevention program, and you have one specific for the general population, and then you have one specific just for people with disabilities in your organization. Again, you might think this is great, we're meeting the needs of this population, but they still feel separated and othered, and you're still making a very strong line in the sand between the two types of groups. So what we're really striving to do is promote true inclusion, where all of these individuals, regardless of their ability, can come together and utilize the same program or service at the exact same time. So that's really what we're striving for when we mean inclusion. All right, I'll turn it over to Rebecca.
Perfect, thank you. So following inclusion, it's critical that whatever efforts you are doing, you should partner with your local disability organizations. And you'll hear that a lot from us. Partner, partner, partner. This way you can create and ensure healthy opportunities for people with disabilities, and that's available in all programs and communities. So it's good to understand the needs of your organization and the program. So is there a specific type of assistance that you're looking for that maybe you could benefit from a particular organization? Or perhaps you're wanting to create some inclusive handouts and would like some Braille format. Well, connecting with somebody or an organization that provides services for individuals with vision loss would be a great start for reaching out. So we're going to look at a few examples on our next slides too.
And Lindsay, let me stop share and reshare real quick, just so I have my audio that goes along with the video and everybody can hear it. All right. Okay, so we, in keeping with partnerships, we wanted to highlight one of our really successful partnerships that we did about 2 years ago at this point with our local chapter of the American Heart Association. And they offered a program called the Mobile Kitchen Series, which is exactly what it sounds like. Basically, they'll come and meet you. We did it at the local library, set up an entire kitchen, and community participants can come and be a part of it. And so with this particular effort, really was, not only those partnerships, but the true inclusion, because we had about a 50-50 split between individuals with disabilities and individuals without disabilities. So we'll just show a quick video here to showcase that.
Heart Association is really looking to partner with community organizations to learn ways that we can work with individuals to improve their lifestyle choices. So the Mobile Kitchen aims to have that hands-on learning experience with people. So not only talking to them about how to eat healthy, but actually showing them the skills that they need to eat healthy. So this is actually our first Mobile Kitchen series in Lexington. So we're super excited to partner with UK Human Development Institute, and we look forward to all the Mobile Kitchen sessions to come. So the Mobile Kitchen series is based off our series called Simple Cooking with Heart. And what it is the Simple Cooking with Heart is a curriculum that's 8 weeks long and teaches people about healthy eating. And there's typically a chef that does a demo, and then the participants taste the food. But with Mobile Kitchen series, you're actually taking that one step further, and you're able to cook with the chef. So it's one thing to be talked to about educational tips, and it's another thing to actually get that hands-on learning experience. This series, we're able to take a recipe and take what is typically kind of boring to read through a recipe that's all just words and put pictures with it. So that universal design just helps people that are needing a little extra assistance when reading through a recipe. Maybe they're a visual learner like myself. So it's really cool to just be able to see people take a recipe and truly be able to learn from it versus just, kind of looking at a recipe and having to follow the word steps. They have those pictures to help them as well. Our idea was to work with people to teach them that they don't need to be scared of cooking.
So that's just an example of one of the tremendous partnerships that we have.
So I know a lot.
And built on really what Rebecca was saying.
Thank you. Yeah, that's a great example of a partnership and working together. And so think to yourself, who are your allies in inclusion? You don't have to be an inclusion specialist yourself. Like, there's several organizations out there that you can begin working with. So within schools, there are several individuals that you can turn to for their expertise in inclusion and with partnership. So this may include special ed teachers, adapted PE educators, or even school nurses and allied health professionals such as physical or occupational therapists. In healthcare, hospitals and rehab centers are also great connects, especially again for those allied health professionals who may have experience adapting activities on a regular basis or may have access to adapted equipment as well. And then of course, your community. Looking at the community at large, you can find allies from the government sector and personnel, such as an ADA coordinator for the city or town, maybe a mayor's committee for people with disabilities, and also just folks that are in the parks and recreation area too. And then taking a deeper dive into the community, you can also look to disability organizations such as Centers for Independent Living, which exist in every state, even Kentucky, and also looking at familiar organizations such as Special Olympics or Easter Seals as well. So there's many condition-specific organizations that serve individuals, for example, with autism, muscular dystrophy, or multiple sclerosis, struggling with that word today, MS. A lot of these groups can be national, and then they also have local chapters too. So I encourage you to look in your area and see who is involved and what organizations you do have local to you. Next slide. And so as you continue to think about who you can reach out to and build more connections with for partnership, it's critical that to its fullest extent possible, your approach includes a cross-disability focus. So this means that your implementing agencies should reach out to a variety of organizations to be able to address the needs of people with sensory disabilities, intellectual, mental health, mobility, intellectual limitations. We don't want to forget about anybody. So we're trying to reach out and really focus on that cross-disability reach. So begin to think about who you can connect with to support your work. And in addition, also, you always want to remember to avoid that tokenism. So involving people with disabilities, use them in a meaningful and productive way. And so essentially, again, we've kind of mentioned it already, but who do you want to reach out to? Who should you be asking to bring to the table when it comes to partnering with individuals with disability and finding those people who have the expertise? So who else needs to be there? And most importantly, do your partners together represent that cross-disability focus that I just mentioned? So again, that's including a variety of individuals and a variety of disability organizations. So we want to hear from you. Please use the chat box right now to share partners that you've either actively partnered with or maybe a new one that you're thinking about that you might be able to now engage to make your programs more inclusive.
Yeah, thanks, Rebecca. We'll give you all a couple, minute or so to think about this. But yeah, and it's really, and maybe your answer is nobody yet. Maybe you've never connected with a disability or inclusion or accessibility organization. That's part of it. And that we'll get to that in the next slide about, some first steps. But yeah, just take a moment and think about maybe who you have partnered with in the community before or who you would like to that you know about. Let me see some folks in the chat. YMCA, perfect. Yep, YMCA is a great one. Special Olympics Kentucky, they're awesome. Extension agents, local food bank, churches, all great places. Yep. Centers for Independent Living. which we'll talk about here, local organizations for specific disabilities. So that might be the local Down Syndrome Association, exactly. Yep, economically, there are people, yes, that's a great point. So there in the chat, it says, economically, there are people with disabilities that are on and below the poverty level. And I think that really speaks to what Rebecca was saying about that intersectionality piece, because it's really hard at the end of the day to separate all of those different social determinants of health. So most likely where folks are going to be living in poverty or different minority, racial, and ethnic groups, you're also going to have a higher presence of disability, absolutely. Nick Pad, ooh, nice. Glad that you could join us again. Elder care, yep, Generation Center, all great ideas. Yep, subsidized housing or any like congregate settings, like homes or adult day facilities, absolutely. Local center for aging. See, that's great. So you all are already doing, you know, great work in making meaningful partnerships in these areas. That's awesome. So again, you know, if this isn't maybe an area that you all have made inroads with, that's okay. And that's why we're here, and we're here to support you. So this is a list, just some broad organizations in the state of Kentucky that you might consider partnering with. And I'll call on Austin to explain a couple of these as well. But, you know, like we said, we're the Human Development Institute, and we have our health team, but there's also a lot of other projects related to education, to employment, to early child care that's involved. And then we have the HCI Cath Center, which provides assistive technology and like physical accommodations that people can buy or rent from them. We have Centers for Independent Living, which were mentioned. So Center for Accessible Living, which I believe is in Louisville, Austin.
It's in Louisville, and they also have a satellite office in Bowling Green, but they serve all of Kentucky.
And then Independence Place is one here in Lexington, Down Syndrome Association of Central Kentucky, Down Syndrome of Louisville. And then at the state, we actually have a really strong relationship with the Division of Developmental and Intellectual Disabilities, which mainly focuses on the Medicaid waiver programs for these individuals. Kentucky Protection and Advocacy, Gathering Strength, which is an awesome organization in Louisville that focuses on health and wellness for individuals with spinal cord injuries. Special Olympics, which we talked about, Project Carrot, which provides assistive technology also, and then the Commonwealth Council on Developmental Disabilities. So just some ideas of, you know, organizations that you might want to connect with, and we'll be sure to send out these slides and all the resources after the fact for you all as well. And so in thinking about, and we're going to dive a little bit deeper into some inclusion components, but some general things to think about when trying to make inroads or trying to connect with disability organizations. You know, there's some things that can definitely help foster that relationship to be positive and sustainable. So first is just mainly be curious, learn about what they do, who's involved, who they serve. Really, you may have never be familiar with this organization, so you're not even really sure, you know, what the opportunities for y'all to work together are. And then understand the mutual benefit, you know, making sure it's a symbiotic relationship between both organizations and you both are gaining something. Be willing to learn and adapt in order to grow, because sometimes these conversations might be uncomfortable because these organizations may point out that what you're offering isn't as accessible and inclusive. So be willing to listen to them and take those suggestions and be willing to grow. Utilize lived experience. That is a huge one that we preach. There's the saying within the disability community is nothing about us without us. So basically saying, you know, planning, you know, for inclusive programming should include people with disabilities from the get-go and those lived experiences. And then lastly, as Rebecca was talking about with tokenism, don't pose disability as an add-on. Remember that last inclusion photo where it's actually infused across the board. You don't want it to be a separate piece that you feel like you have to add on, but something that you want to infuse across all of your programs.
So now we're going to kind of dive into some issues of some of the nuts and bolts of how to really make a program accessible. What are some of those elements that you want to look at? And Danielle in the objectives earlier talked about what's called the grades framework. And that's what's actually what you see on the screen. It's nothing you really have to remember, but GRADE stands for Guidelines, Recommendations, Adaptations for Including Disability. It's a framework we developed to help us understand and adapt evidence-based programs so that they are inclusive for people with disabilities. And the GRADES framework has 5 domains, 5 parts to it that I think you can use, and 5 parts that you should be paying attention to when you're looking at providing inclusive programming wherever you are. And those 5 areas or domains are the built environment, of course, that's the brick and mortar environments and in the buildings. The services that are available, so that could be something like sign language interpreters for deaf participants. The instruction, so what are you actually teaching, and is that presented and provided in an accessible way? And one of the things that we've really are trying to figure out and doing at NCPAD is really taking taking evidence-based programs and adapting the instruction to the point where it's more inclusive, but not violating, it's keeping in fidelity with the original program. So many of you know, when you have evidence-based programs, there's content that you have to provide, and you can only change it so much. And a lot of the adaptations when we look at evidence-based programs happen in the instruction domain. We look at equipment and technology. So what kind of equipment and technology do people need to equitably participate in your program? That could be anything from an assistive listening device to an adapted piece of equipment to a wheelchair accessible scale. If you're, say, for example, a diabetes prevention program, and I'll talk about that in a moment. And then ultimately what we want is to really look at policy. What are those rules and practices that govern how your program is run? And are they inclusive? And do you see people with disabilities in the policies that govern your program? And so those are the 5 areas that we want to encourage you to look at when you are looking to be more inclusive. Next slide. And so now what we're going to get into is maybe more about a discussion about communication and effective communication, and really one of those elements of an inclusive program that creates a welcoming program too. So we're going to go through a few different topics and slides on this. In general, you want to use the same policies and procedures that you do with people with disabilities that you do with everybody else. It's very, very important to remember, and I think we've said this a couple of times already, disability is not synonymous with disease. Disability is actually, one of the sayings we have is disability is a demographic, not a health outcome. This is a group of people that you're trying to accommodate. So it's important to remember that. Use the same, again, established procedures for and policies for any kind of forms and intake and other procedures that you do. Use the same for people with disabilities that you do for anyone else. As we've stated before, partnership is important. So if you need to consult different experts or individuals with disabilities themselves for assistance on how to go about creating inclusive procedures, do that. And then remember that inclusion is about planning ahead, and it's often about just being creative and trying things. And I think that's where I think the partnership idea is so important, because people with disabilities, I'm a person with disability myself, we often are having to come up with different creative ways to get around our communities and to sort of do what we need to do every day. And so that's why partnership is so important there.
And one thing that I wanted to add, particularly on that second bullet point, which maybe is just a little seed to keep in the back of your mind, is, in thinking about using the same forms and applications for all participants, say you have an individual with Down syndrome coming into a class that you're offering, and you're immediately concerned that they might not feel comfortable or accurately fill out the forms that you have, that's your cue that maybe those forms aren't accessible. So if you have a concern that someone isn't able to fully access a form, then that means that's a call to action that you might need to make some adaptations there.
Again, some general principles. Again, do apply the same procedures and principles for all program participants. And as I've kind of alluded to, it's important to really establish open communication, maintaining privacy and confidentiality as appropriate with participants with their disabilities and with their caregivers and with others who might be part of their support system. Open communication is very important in understanding how an individual lives and how you can incorporate health and wellness into their daily life. Using inclusive language, we'll talk about that in just a second. There's some things and issues to remember with that. And then remembering to treat the person as a person and speak directly to the participant, not their caregiver, not to an interpreter, not to their companion who might be there as a personal care assistant or something like that. Always your responsibility is for your participants. And so remembering to talk and communicate directly with the participant is a small issue, but it's an important one. Effective communication, other issues. Remember that assistive devices are personal property and someone's independence. So I am always keeping an eye out on my wheelchair and making sure that it's near me. And that should be the case for anyone that you work with. Always ask, of course, if you're not sure what to do or how to communicate or how to adapt. Allow for extra time. Don't always assume someone needs assistance. You want to make sure that you're always trying to maintain independence. Don't be overprotective of someone. Give somebody the dignity that comes with taking a risk. Again, let participants make their own decisions. And then, as I said, creativity often is what is required when you're talking about creating an inclusive program. So experiment with different equipment, teaching methods, activities. And again, you can learn a lot from different partners that you have in your community and in your state. So this is the inclusive language that I mentioned, and I'll invite our colleagues from Kentucky to share their thoughts as well if they'd like. But part of creating an inclusive and welcoming environment is the language that we use, and particularly not only in personal interaction, but also in how we're recruiting people. What kind of advertising are we sending out to the public and to people with disabilities? And what kind of language are we using in that advertising? And does it welcome people with disabilities? So often when we talk about disability, it's talked about in a very negative way. And you see this a lot in the media. You see words like crippled, or I still hear this today, wheelchair bound, confined to a wheelchair, handicapped, euphemisms like physically challenged, or you're a victim of, or you suffer from. And of course, the R word, retard or retarded, is not acceptable to anyone, and for individuals with intellectual disabilities in particular. And so really talking about disability as a neutral, and really thinking about it in terms of that social model of disability. So I use a wheelchair, I have a disability, I experienced a stroke, or I have Down syndrome, I am a disabled person. That actually brings up another issue of what we call person first versus identity first language. And person first language is, I am a person with a disability. It's sort of a reminder to, I guess the intent is for it to be a reminder to focus on the person and not just see their disability and see their different level of functioning first. Identity first language is, I'm a disabled person. I have spina bifida and I have paralysis, and that does define how I live my life and who I am, and that's okay. That's kind of the idea behind identity first versus person first. There isn't an agreement amongst people with disabilities as to what is appropriate language to use. And so I think this is an issue where it's a good opportunity to partner again with people with disabilities so you understand what is effective communication, what is the effective language that you can use to get people with disabilities into your programs. And I didn't know if anybody else wanted to comment on this one.
I would just add, I don't know if this has anything to do with this slide, but also don't assume, I guess, because, well, Lindsay knows this. I get like someone random will come up to me and ask if I'm a veteran or get me something or buy me something. Like, just ask questions. I know everybody is different and may not like questions, but I like questions. So I'd prefer people, instead of assuming, to just ask me a question about what happened to my legs.
And Austin, if you wanted to go ahead.
Yeah, so I think Chris did an excellent job explaining that, you know, there is person first identity, or person first language, and then there's identity first language. And for the past bit, it's always been the assumption that person first language was what we should be saying. But as people with disabilities have been involved in the advocacy and the work, they've actually come out and said, you know, like, my identity is such a big part of who I am. And there was one individual that experienced cerebral palsy that actually said recently, like, when I go to, I'm not taking my disability to prom, my disability is always with me. And so just wanting to acknowledge that there are individuals, and like Chris said, that there is not an agreement in the disability community about, do we use person first or identity first? So going back to what Morgan says, it's really important to ask and make sure you're including the disability community in your programming planning or your recruitment, so that you are making sure that you are being inclusive in your language.
Yeah, and we got a great question in the chat. So this is another example of identity first language. And so I'll use myself. So I have type 1 diabetes. And so a person first way to say that would be a woman with diabetes. An identity first way to say that is a diabetic. So it's really, and another group that has very strong feelings towards this issue is the autistic community. So individuals, who are on the autism spectrum, the majority, obviously everybody's different, but the majority, it's starting to go more towards that individuals want to be called autistic, which is identity first, because they identify that autism is a strong part of who they are, versus person first, which would be individual with autism or someone experiencing autism.
And then one more example is the deaf community. And this is where it actually all kind of sprouted from. And the deaf community is very proud of their identity and actually is capital D deaf, and really embraces that experience that they navigate the world with.
Great question. Thank you for that.
And I just wanted to follow up into thinking about not just the words that we use, but how we're speaking to individuals. And so thinking about, as Chris is going to talk about on the next slide, some of the barriers. And one of those is attitudinal. So even if we're thinking about the words that we're using and making sure that we're trying to be respectful, it's also how we're interacting with the individual. Or so for me as a parent of a child with Down syndrome, I often have to combat the eternal child-like attitudes towards my daughter. And I have to advocate for her and help to teach her to advocate to be treated as an individual and to be respected as such. So even if someone is not using the R word towards her, they might still be interacting with her and speaking to her in a way that is baby-like or downplaying her ability to accomplish something. So I think that's also important to think about here, that it's not just the words we use, but also how we're portraying our attitudes and our interactions.
And just before we move off of this slide, I just want to also point out, like Chris said, when you're, thinking about the intention might be good, but if you're sugarcoating disability, the disability does not want, community doesn't want that. So the term special needs, like I know it comes from a place of like good intentions, but we've got to move away from it. People with disabilities do not have special needs. They have needs just like everybody else. It's just how they meet their needs might look a little different than what yours or mine might look like.
And I would add just one more thing too, that kind of language like special needs that Austin was talking about, it tends to segregate people even more. And you see that in areas like emergency preparedness. We see special needs registries, and when that kind of a concept excludes people with disabilities and doesn't integrate them into the response and to the system that needs to accommodate everybody.
All great points. Thank you all. And I think just one last thing, we keep adding things because this is such an important topic, but really kind of connecting all of it is if you're not sure, just respectfully ask. And just like how, we're kind of moving towards asking what folks' preferred pronouns are, it falls under that same idea, and how Lindsay said, but do it in a respectful way, not just like, well, what are you? What do you have? That could come off very disrespectful, more so of like, how would you like me to refer to you in terms of, a person with a disability, or do you prefer autistic or a person with autism? So, folks will know if you're coming from a good place and asking in order to be respectful. Great conversation. All right.
So when we look at, so we kind of talked about, different, well, we've alluded to the idea of barriers and kind of talked a little bit about what they are generally. And so we're going to dive into them a little bit more specifically now. But when we look at barriers that people with disabilities face, we can kind of categorize them into three different concepts. Architectural barriers, which again is kind of the brick and mortar issues that we all sort of think of first, with the ramps and the accessible parking and restrooms and things of that nature. The programmatic barriers that we've talked a little bit about already too, with, that's the instruction, that's the kind of curriculum you have, and is it accessible and welcoming to, accessible to people with disabilities? It's the exercises that you might be doing during your class, or the kind of tools that you're using when you're teaching nutrition or cooking. That's the programmatic barrier. And then the final one that Lindsay alluded to a little bit are the attitudinal barriers. And we know from research, people with disabilities have told us that the most significant out of those three categories, the most significant category of barrier to people with disabilities are the attitudinal barriers. That is the biggest barrier that people with disabilities say they face. It's the attitudinal barriers, the stereotypes and the biases that we hold when we interact with and talk about and work with people with disabilities. So that's why we keep talking about inclusion. We keep talking about creating that welcoming environment, because that's where those attitudinal barriers lie. And I think what you can do is you can take each of these three categories and maybe even break them down further and look at some subcategories of specific kinds of barriers. And I'll let some of the folks from the Kentucky team talk about that.
Mm-hmm. Yeah, thanks, Chris. So definitely, especially within the programmatic large bucket barrier, but again, these all kind of span across all of them, is we see large barriers when it comes to information, especially health information. So, consider how your information that you provide in your programming is given to you and also received by individuals with, say, a cognitive disability, a hearing impairment, and then low or no vision. Do you have other resources and broad ways to offer things where all of these individuals could still benefit from your program? And then additional considerations are things like language, culture. One of the examples that Lindsay usually gives is on a lot of health information, when there's a good, medium, bad range, it's green, yellow, and red, which to us makes sense. But if you have an individual who is not from the United States and doesn't understand what those stoplight colors mean, they're not going to benefit from that adaptation. Or if you have an individual that's colorblind and the only marker you use are those colors, that's not going to mean anything to them. So just being mindful of all of the different ways, going back to our activity of how people learn and receive information. And then along with that is communication barriers. So this mainly happens in folks that have hearing, speaking, reading, writing, or understanding barriers. And that really means so many things. It's so broad. So not even everything from the appropriate literacy level all the way to, do you have a sign language interpreter? Do you have closed captioning? And really hear something that can really be helpful in that communication and making sure that that barrier is removed, or at least checking to see if there's a barrier there, is using what's called the teach back method. So I'm sure a lot of you are familiar with that, but basically, say you're sitting with an individual in one of your classes and you're giving them nutrition recommendations, instead of just ending the session saying, okay, you understand, you're good. And they say, yep. Really taking a moment to say, okay, here's what I told you about your daily caloric need. Can you back to me, tell me what you think your calorie need is, and then have them explain what they think they learned from you. And then if there's some sort of discrepancy, you have that opportunity to catch that mistake right then and there and help them correct it and better understand. So just taking the time and really making sure that individuals are getting the info they need and the communication that they prefer.
Can I add something to that real quick?
Go for it.
So an example I like to give, and this is something I've had to share with my brother's school team before, because he does have a speech impediment, is that people often come at, well, if you don't communicate the way that, society says, that there's this like assumption that you're not as intelligent, or you don't understand. And so I like to remind people of Stephen Hawking. He is considered one of the most brilliant, intelligent people who have ever lived. And he did not communicate using his own spoken voice. He used assistive technology. And because of that assistive technology, he was able to share all of his wonderful knowledge with the world and like really change like the science of the work, like the globe. So just something to think about. When you do, if and when you encounter people who don't maybe communicate with spoken word.
That's a great point, Austin. Yeah, definitely don't equate spoken language or spoken English as not equal to intelligence level. Thank you. And then financial barriers, which we know is one across the board and goes back to that intersectionality piece we had talked about in the beginning, but we know that people with disabilities are more likely to live below the poverty line. They're more likely to incur additional healthcare costs. And actually 1 in 3 individuals with disabilities have an unmet healthcare need in the past year because they couldn't afford it because of the cost. So just knowing that all of these barriers are more pronounced within the disability population because of the social determinants of health and disparities that they experience. All right, Rebecca, I will let you intro.
Sure, I can introduce this one. We'll end up diving into some specific tips that support different types of disabilities. And so this is basically like a disability etiquette or educational video that we think it's pretty humorous, but also gets the point across. And so we'll let you go ahead and play the video.
Oh, hold on, I'm gonna stop sharing. It popped up. All right, here we go. Let me play this ad.
Your Deli Caramel Squares makes life a bite better.
It's telling us to have a snack. That's what that is. All right.
Good morning, Bob.
Morning there, big man.
no need to be awkward. Poor Bob. Like so many of us, he just doesn't know how to interact with people with disabilities.
It's pretty easy, really. People with disabilities are people first.
We need the same things that every person needs, like respect.
Good morning, everyone.
Attention! Okay. Maybe we need to be more specific.
The easiest way to show respect is to focus on the person, not the disability. It's okay. You'll get the hang of it.
One easy way to focus on the person is to watch the person signing and not their interpreter.
Or their companion.
It's really cool that you'd like to help, but do us both a favor and please ask me first. What you think might be helping?
I got you.
Wait, ah! Oh no, might actually not.
If you'd like to offer me help, let me hold on to your elbow. Don't take mine.
Hey, would you like to take my arm?
Sure.
Assistive devices help us to live our lives. They're really important and really personal.
Grabbing them only makes it weird for everyone.
What?
Please only touch our devices and service animals if we've given you permission. And don't take it personally if I ask you not to. Remember that my service animal helps me all the time. Neither of us would like it if we were separated.
Remember, we make our own decisions. We sign documents, vote, volunteer, work, and pay taxes.
We get married.
So don't address me just because I have a great smile.
Just because I'm blind.
May I help you?
Does not mean I'm deaf.
I think he said he was gonna come. Just because I'm deaf doesn't mean I'm blind.
And just because I use a wheelchair doesn't mean that I can't sweep you off your feet.
So take a deep breath, relax. We don't bite.
Unless we're really hungry.
Hello there, ladies. How are you?
Hello. And if you're not sure what to do, just ask.
Hi, would you still like to see a menu?
No thanks, but can you please read it to me?
Sure, definitely.
Just treat us the way you would want to be treated, and we'll all be okay.
Good morning. Good morning. Morning, Alice.
Right.
Awkward no more. Nice job, Bob. Go forth and be human.
I haven't seen that video in a really long time. That made me laugh really hard. All right.
Yeah, that was great. Especially too, the couple that talked about getting married they're in a movie called Profoundly Normal. If you're interested, with Kirstie Alley from back in the day, and so actually got to meet them over Zoom over the past year and hear a little bit more about their story. So the image that's on the screen. So really, really cool.
I love that. All right, Rebecca.
I was wondering, I was like, I can't remember if I was doing
No,
this.
you're good.
Was. Yeah, so these are some tips. We'll dive into each specifically you learned in the video as well, but we'll dive through vision loss right now and then move through some other disabilities as well. But for people with vision loss and individuals who use service animals, you want to speak directly to the person, identify yourself when you're speaking to them, and just be as descriptive as possible. If you're talking to somebody and then you leave the conversation, be sure that you tell the person, all right, like I'm leaving, so that they're not just standing there still talking to air. So be as descriptive as possible, identify yourself. Be sure to speak clearly to the individual in a normal tone of voice you saw in the video. You don't need to shout, just relax and be yourself. speak in a normal tone of voice. And then finally, never touch or distract a service animal without permission. I know they're super duper cute. Everybody, well, not everybody, but me especially, really, really love animals, love dogs, but those dogs are working, so please do not touch them. Next slide. For individuals with hearing loss, it's important to gain their attention before starting a conversation. So that might be a tap on the shoulder, or again, identifying yourself, maybe a wave, or some way getting their attention before beginning the conversation. It's helpful to look directly at the person. So if they are reading your lips, they are able to follow along with you. And again, speaking in a normal tone of voice will also be beneficial as well. So if you're yelling, your lips might not be moving as what you would be if you were speaking a normal tone of voice. So also keeping your hands away from your face. So if you are, for instance, if this webinar or presentation was in person, if I'm looking at y'all and then I'm turning around looking at the blackboard behind me and then looking back at y'all, looking at my audience, that's very, very distracting, especially if somebody's trying to follow along, read my lips for assistance. That's not going to work out too well for that individual or that participant in your class. So just talking directly to the individual, facing the class, avoiding gestures as much as possible can help benefit that person to follow along with you. Again, you saw in the video, speaking directly to the individual. Don't speak to their interpreter or maybe their family member. We want to acknowledge that person because that's who we're supporting and providing that information to. If you don't have a telephone or one that texts, there's a line that you can dial. It's dial 711. And this way, I always bring Kristen to help me explain this one to learn a little bit more, but it's basically a relay service that you dial this number and then it's a translator on there or an operator that helps guide the conversation with you as well.
Yeah, and this is a stipulation actually in the telecommunications section of the ADA. Basically, as Rebecca was saying, it allows you to talk to someone who has a communication disability and uses maybe nowadays it's more like video chat, where they would maybe sign to a sign language interpreter over video, and then the sign language interpreter would relay the message to you, and you'd go back and forth. And there's actually specific sort of language and question and wording that you use when you make the relay phone calls. But if you need to contact someone who has a communication disability, can't use a regular phone, dial 711. And somebody actually in the chat asked about, and if anybody wants to comment on this as well, asked about with COVID and masks. There are masks out there that are clear to allow for.
Lindsay.
There we go. Thank you, Lindsay. To allow individuals to be able to allow a deaf individual to be able to read lips and kind of see what you're how you're communicating. So there are clear masks. I didn't know if anybody else had other ideas or thoughts.
I recognize if I'm on mute and you have it set to speaker view, you might not be able to see it. So this is what the clear mask looks like. That's when you put it on and you're speaking, you can still actually have to get head on upside down because there's a little nose spot. So you can see my lips still moving, which is helpful. So these can be purchased. We just got those online. So got a box of those to have for when necessary.
I've also seen, I don't know if it works or not, but they also have those shields. I've just seen like coaches wear them in football games. They have like the face shields or something.
Yep. And then I would say, if it is not possible, if you don't have a clear mask, or if it's not possible to remove your mask, asking, maybe working with the individual or someone that's supporting them for a different next best way to communicate. So that might be writing, that might be texting on your phone. But again, it just goes back to that asking piece. Or maybe if you can stand 6 feet apart and lower your mask and talk that way. But yeah, it just goes back to the principle of just got to be creative sometimes. But that's a great question and something that it just highlight COVID, one of the ways COVID has highlighted the disparities even more.
Yeah, so talking or writing your message while you're talking, wow, mixing that up already. Writing a message while you're not talking may be helpful, or that might be a way to communicate too, is trying to get it down in text or on a piece of paper as well, may be another way to translate information. And then also, if you are calling a participant, maybe health coaching, let the phone ring longer than usual. I'm a little guilty of this sometimes, of like 3 rings, nobody answers, whatever, they're not going to answer. No, allow the phone to ring as long as possible, because it might take an individual a little bit longer to get to the phone or to answer it, or might be having somebody help them answer it as well. Next slide. Next, we have speech disability and some tips. So if you don't understand a person, please don't pretend. I've been in a situation before, maybe we all have, even just talking with friends, they say something and you say, what? And then they repeat themselves and you go, okay, what? And then they repeat themselves a 3rd time. And then we're just like, oh, okay, yeah. And you have no idea what they've said. I've been definitely guilty of that before. So we just want to make sure that if we don't understand someone, hey, I'm having trouble understanding, but let's figure out what you need help with, or let's find the solution. If you need to grab somebody else, that's great, but don't ignore them. Don't acknowledge that, or pretend that you know what they're asking. So help that client. If you need to repeat information, go ahead and repeat it back. Repetition helps everybody. That's a universal learning, is repetition. Asking questions and allowing for short answers or a head nod, just to make sure that individual is following along. Understanding, again, that's just another way to make sure that that participant is understanding the information that you're giving. So really involving them and allowing for short answers or head nodding. And then finally, try not to overspeak or finish somebody's sentences. Let them be patient, allow them to take their time, and let them complete their sentences. That's also just a respectful thing to do for anybody as well.
And one thing I wanted to add here that has really helped me, when I was first entering this kind of disability world, and especially when I was having trouble understanding what folks were saying, if you can at least, one word like that you can pull out of there, and then that will help you kind of flush out, like Rebecca was saying, repeating back to them. You say, okay, I caught that you said the word, you need to go to this building, but I didn't really necessarily hear what you said. If you can at least pull something out to help flush out the rest of it, that is really helpful and helps you from just kind of feeling uncomfortable and just being like, what did you say? So, even if you can just pull a little nugget out of there.
For individuals who have an intellectual disability, again, repetition is key in allowing that time for the individual to learn and master that new task. So repeating the information, maybe repeating the demonstration, or allowing them to practice right in front of you. If you're wanting them to do a cooking demo and they're practicing with you, it's really, really helpful just to allow that extra time for them to learn. And that way they can also ask questions. You can correct them right there if needed as well. Offering assistance to complete maybe registration forms or handouts, or understanding written directions. Of course, you can offer assistance, but of course, wait until it's your assistance is granted, or permission, there we go. Wait until they grant you permission to help them. And of course, you don't want to over adapt or over assist. Allow that individual to do what they know they can do, because they are the expert themselves of what they can do. So allow them to do that while you can still offer your assistance. Providing extra time for decision making. Again, that kind of flows back with all of our other tips of just allowing that person giving them that extra time and allowing them to have that time to learn or to make a decision as well. Using short, precise language is super helpful as well. So simple words, short phrases. This would also be in maybe on handouts or instructions in class. Short tasks are very, very helpful. And of course, always checking to see if they're understanding. So ask a question followed by that brief yes or no if they're understanding. I think there's a few more tips. Yes. So of course, kind of if you've been following along today, treating adults as adults, so relax and be yourself. We are all people, so treat people like people. That's what we want to preach about, right? So include them, treat them like an adult, treat them with age-appropriate materials as well. So again, not over-adapting and treating people like people. Be patient, flexible, and supportive, and of course, take the time to understand the participant, as we've mentioned, and then don't pretend like you understand, which I think we've already covered a few of these bullets. Oh, and then the final bullet on your slide is if you're in an area with many distractions, consider moving to a quiet or private location. So really try to minimize outside noise, outside distractions, or possibly even identifying a safe space. Some individuals may become overstimulated in certain situations, and so allowing that person to know this is a safe place, or maybe this is the room where if you get overstimulated that you may go to, and kind of release that overwhelmment. Overwhelmment, is that the word I'm looking for?
Yeah. Thank you, Rebecca. I think this also goes back to in thinking about the multiple methods that we've established, but is important in thinking about as a health program. That's what's really important, providing those opportunities for individuals to be able to let you know what is the best way for them to access the information or the activity. My best example of that is when I first started doing health promotion program for individuals with intellectual developmental disabilities. I had a young man on the autism spectrum who was relatively nonverbal, and it wasn't until halfway through our 12-week program that I ever gave him the opportunity to read. It was a little vignette that we were going to use as a part of an activity, and he picked up the paper and was able to read it and then respond as to what his answer was. And it shouldn't have been 6 weeks into that program before I gave him that opportunity to show me he had that ability. So I think I just want to give that example to follow up what Rebecca is talking about is making sure if we're asking questions, we also want to make sure that we're also providing opportunities for individuals to be able to express what their abilities are or what their strengths are.
Thanks, Lindsay.
So as we've kind of been talking about, you know, the goal of all of this, what we're talking about today, and the goal of what we want to encourage you to get to is inclusion and really creating equity. And I think, you know, a lot of times, and especially in public health, this is kind of a buzzword, for lack of a much better way to put it. And it's important to understand sort of the difference between equity and equality. I really like this infographic of the bicycles. This is from the Robert Wood Johnson Foundation. Basically, equality is everybody gets the same treatment. So everybody gets the same bike, even if it doesn't work for them. Equity is everybody gets the same opportunity. And so you get what you need to participate in the bike program, whether it's a hand crate bike or a larger bike or a children's bike. So I think this is kind of what we're talking about. It really embodies what we're talking about today, providing people equitable opportunities and experiences and what they need to participate in your program. It all goes back to that, you know, the social model of disability and how we set our programs up really it can either enable or disable a person. So it's really important to understand sort of this is what the goal that we're shooting for.
And then to take that a step further is really, you know, I'm sure you all have seen a version of the two images on the left-hand side of equity and equality when it comes to individuals looking over a fence and standing on different boxes. And then, you know, we like to take that a step further to accessibility. And that can kind of be interchanged. I've seen people call the one on the far right freedom, accessibility, like anything that removes the barriers. So you can see that, you know, these individuals are able to access watching this game the exact same. They don't need any additional supports. So it really, it makes it inclusive to anybody that were to join, but also too, sometimes with this equity piece, you know, this shorter individual, which represents, you know, minority populations, again, that maybe need additional supports and services, there's often in times a lot of inherent blame that comes when somebody needs additional supports. So it's really taking away that victim blaming mentality of, oh, well, you just need additional help. Like, why can't you function like the rest of us? You know, a lot of people have that unfortunate mindset. So it really helps mitigate some of that as well as, you know, along with providing full accessibility. All right, we're going to
Danielle, do you mind going back? Because Chris had something that I think is really helpful to point out about the last picture.
Oh, sorry. Got it. What were you saying? Sorry, Austin.
Chris, do you remember what you shared about?
Yeah. I couldn't hear you. Yes, absolutely. So I think the only other comment with this is, I would say on the far right picture with accessibility, that shorter individual, whether it's a child or not, maybe isn't getting the same view as everybody else. So is there a way to remove the fence, or, you know, do we need to put bleachers in, you know? Is there a different way to give everybody the same experience and give everybody the same view? So I think, you know, yes, that's accessibility, and they could see and watch the game, but is it the same experience? And so I you know, it goes back to that idea of, are we creating an equitable, welcoming environment? And you know, I keep repeating that, you know, but I think in what you do, you're asking people to change behavior, and that requires feeling welcomed, feeling like you have the same access and same experience as everyone else. So just a little commentary on that last picture on the far right.
Yeah, and Chris, I feel like that goes back to there was a Q&A posted about the wheelchair, the ramp with the stairs, about how that can be unsafe. And so pointing out, there's this really good quote I heard recently that accessibility is not a solution, it's like evolution, and it's ever evolving and changing. And so I think, you know, what Chris says goes back to what was pointed out in the Q&A, that, you know, as we adapt and innovate, we might think, oh, this is the end goal. And then we realize, like, this created different problems. And so just recognizing that this is always changing, and to be open to new ideas, and recognizing, like, oh, I think I figured it out, but wait, someone with a disability or someone else points out, this actually creates a barrier for me.
Yeah, I agree. Absolutely.
Great, thank you. And there's a comment in the chat from Colin too, which is a great point, is this doesn't just apply to health programming like we're talking about, but he pointed out, or they pointed out, I'm not sure your pronoun, sorry, that in a school setting, this would really apply too. So thinking about children who need extra supports, and again, if we can just make it even across the board, that would help out a lot. Okay, so now we're gonna move on to a really fun activity. Again, we're gonna wake y'all up, and this will be the last major topic. That we have a couple other slides after this, but we're getting pretty close to lunchtime at 11:20. So I'm gonna stop sharing my screen and turn it over to Austin, who is going to explain the activity. Perfect, thank you.
Morgan and Lindsay, you want to start your spiel first?
Sure. Yeah. So Morgan is going to introduce you all to Kyle. Kyle is an individual that is wanting to take your program that you're implementing. And so he is an individual that we are going to work on supporting to be able to be included in what you got going on.
Yep. So this is Kyle. He has an intellectual and physical disability and diabetes. He graduated from high school and transitioned to being at home with no transportation and no job. He drinks up to 4 or 2 Ale-8 soft drinks a day and does not have the time or knowledge to prepare healthy meals at home, which means he typically eats fast food. When in school, Kyle was more active in sports, but now spends a lot of time watching TV.
Great. So now we know who Kyle is. Kyle's trying to access your program. And in the chat box, Austin has shared a link to the Jamboard. So you should be able to click that link and be able to open it as well and join us on the Jamboard. We can see the ways that you would help Kyle be able to access your programming. So I'm seeing some anonymous animals join in to the Jamboard.
So real quick, just how to navigate or interact with the Jamboard is there is lots of things you can do. You can add sticky notes. That just says, Kyle, save, a post. You can post different colors. You can also draw or write and change the pen color. You can add just text or shapes. But a really cool thing is you can also Google image search and actually insert images straight from Google. So let's just choose a happy, not Apple car, Apple. So if I wanted to say, one thing, Kyle, instead of eating out so much, you might introduce some fruits and veggies into his life. You can add Google image and shrink it or make it bigger and put it somewhere on the Jamboard. And Lindsay, do you want to talk a little bit more about the end goal of this activity?
Yeah, so absolutely. The sticky notes that are already added there are the questions to be thinking through. So we can talk through those together and thinking about, okay, now that we know who Kyle is, he's registered for your program, what barriers might Kyle be experiencing when it comes to accessing your health program? You can feel free to type that in the chat.
Add a sticky.
Yeah. Interact in Jamboard. I'm thinking right now, he might not even be able to access that table that's right in front of him.
Yep, someone said table height, absolutely.
Table height, seating. Yes, absolutely. Sean also said access to the table height.
So maybe think about the types of resources or materials or the way in which you speak about your program. Ooh, whiteboard, room accessibility, yep.
Perfect. And someone has someone put arrange a transportation schedule. Amazing. That's a good point. I'm glad you picked that out of Morgan's introduction of Kyle. He has no transportation. So he would need assistance in being able to arrive and be able to go home, right, to your program. So that's great.
Okay, yeah. And then someone also said, to get there, the transportation, but then also to use and apply cooking in their own kitchen. Yep. And that's something we'll get to. Great.
Excellent. We've got in the chat the room accessibility. So thinking about if there's an elevator or a ramp or something I've experienced even before. I'm working in some older buildings across the state of Kentucky's, the radius of the hallway and even the door width. Something that, if you've got a much older building. And then Colin mentioned the use of interactive devices like an iPad to communicate or do work on. So thinking about that, that's great. We've also got asking Kyle if he would like to set some fitness goals. So thinking about his sedentary lifestyle and having those participant-driven goals that would be able to focus on what his individual needs are as well as his individual barriers. So that's incredible. Good.
And then in the chat, Emily said a great question and thing to consider, especially if you're doing a DPP program, is there an accessible scale if you're going to ask his weight? Yep. And we'll have Crystal talk about that a little bit later on.
Yeah.
Yep. Because we know, especially again with diabetes prevention programs, that's a measure in which participants track their progress is weight. And that really is the basis of a lot of what the program is. So an extremely important part is if that's a big measure that you're supposed to report, you need to be able to take it.
Perfect. I love it. Somebody said find an appropriate exercise facility, which is also something else that we'll be exploring here in a little bit. So you guys are being rock stars right now and digging. This looks great. And talks about asking if Carla, if he likes to the fitness goals, encourage him to carry a water bottle. I'm going to out Morgan. That's one of the first things that he and I started talking about way back in the day was carrying a water bottle.
And I don't have it with me now. I mean, I have a water bottle, but Lindsay will tell you I have this big water jug, and I figured since we're on this long meeting, I probably shouldn't drink that one. Because it's a big.
You do too.
It is. It's a big one. It's a good planning, Morgan.
Ooh, I like the person drawing X's over the chairs, like the
Yeah.
interacting with some of the other features of the Jamboard.
Yep, and then when this is a really important point that brings in like a social piece. It sounds like eating out is this major social activity. Can we figure out whether a recreational sport would be, you know, a different, healthier alternative?
And then in the chat box, I really like this one: adapt the program to culture norms. So thinking about the healthy cooking ideas you're giving, you know, do they align with this person's cultural preferences or just norms? And I think that's really, really important.
Yep.
And Colin mentioned creating a fitness plan or diet plan, like goal, just to help get started, which I think is really helpful. And goes back to what might you need to support and help Kyle if he's identifying these goals. What might you need as the facilitator to be able to support him?
Mm-hmm.
And along with that, some folks mentioned just ask questions about his physical ability. You know, maybe he still has, you know, some physical, he can still, you know, have part of his lower body can still engage in physical activity. So not assuming and asking.
Mm-hmm.
And I think another one, sorry, I know I have the information, but I just like to put it out there because our team has this conversation a lot. And thinking about his limited daily activities around employment and education is inquiring, does he have goals around employment and education? And, you know, is his health impacting his ability to, you know, gain and sustain employment or education?
Lindsay, should I tell them now who Kyle
Yeah, let me
is?
read the orange question prompt to see if you get any other things first. So that one is, who else might need to be a part of the conversation? So we've focused on Kyle, we focused on you as a facilitator, the physical accessibility of the room, but who else might you need to reach out to or partner with to be able to support Kyle to access your program? Ooh, someone else said mental health goals to include that. That's important too.
Encouragement. Yep.
Oh, I love who posted the orange one. I love that depends who Kyle wants involved in acknowledging his autonomy and his self-determination, and that he, you know, he is, you know, has a right to make decisions, and that includes like who he wants to be a part of his journey.
Also, like finding a partner who understands and adapts activity is definitely something for those of us who focus on supporting individuals in the disability community. We recognize that oftentimes there is that close-knit social of support network, whether it's a family caregiver, a paid caregiver, that there's somebody within that circle that has more knowledge of day-to-day activities or access to resources for an individual that can be a helpful resource as well. So making sure to find out if there's an individual who has that network and tap into and have a collaborative approach can really help you. Good.
This is awesome.
Yeah. You guys are, like I said, rock stars. You're doing a wonderful job. So I'll give you all just one more minute to see if there's anything else you want to throw out there on the Jamboard or in the chat. I love Colin's disability don't mean can't. Reference in our comic book, Morgan.
Yeah.
And how important encouragement is. Person-centered goals. Yes, absolutely. Austin, do you want to expand a little bit on what that means?
Yeah, so person-centered goals or person-centered planning is this concept or framework that the goals that should be centered around the person. So thinking about the person's interests, the person's support needs, the person's you know, preferences and all of those things. And so really, you know, that centering that individual at the set of goals. And so thinking just simply as asking the individual what it is you want to achieve, and then thinking outward from there. And I know oftentimes I use the school examples a lot because that's the age that my brother is, But so often when we think about disability and setting goals, it comes from a goal bank, like a word bank, but it's goals, and it's like all these predetermined goals, and it's like we need to individualize these. No two people with disabilities, no two people in general are alike, and so we really need to make sure that that goal, is relevant and appropriate and aligns with the individual.
And I think that also aligns nicely with one of the other yellow sticky notes that talks about asking what Kyle's successes he's had in the past. So working on building those strengths, not necessarily focusing on the barriers, but also focusing on things that he's been successful at to build upon those and work those into the goals as well. It's a great way. Yeah, you guys are wonderful. You want to wrap us up?
Yeah. So spoiler, Kyle is loosely based on who I was before I participated in an inclusive health promotion program. I don't think I mentioned this before, but I was born with hydrocephalus, abnormal legs, and left hand. So when I was in school, I was on the wrestling team and Special Olympics. So that really kept me busy a lot. So I was always on the go. And then after school, wrestling, that was an everyday thing at school. But after school, Special Olympics is like maybe meet once or twice a week. So not really being as active. And like I said, drinking L8s. I love L8. But now I canceled that with water. So, and I like doing this because I can also help people that were like me with health goals as well, because I went to the same program, so I know what to expect.
And that's also how Morgan got the job that he has now, working full time.
Yes, that too.
So to going back to and supporting what Austin had mentioned, that broader picture of thinking about how we're supporting someone's health goals, and that is a foundation across a wealth of other areas, including employment.
Awesome. Thank you all for that participation. That was an awesome activity. So just so my team knows, we're a little bit behind schedule, so I might cut us off just a little early so folks can get to lunch at the 11:20 promise, but we will go ahead and keep going. And Chris, this is you.
Okay. So yeah, the next kind of part of this is about sort of, as I've been saying, planning ahead. What do you have to think about when you're looking at developing an inclusive program? What are those things you have to prepare for? And so that's what we're going to talk about now. And I think we're going to start off with one of our videos that Nick had about recruitment.
So I see you recruiting for your new program. What is it again? Diabetes prevention? That's something I might be interested in. So are you recruiting people with disabilities, such as myself? Have you been successful? Look, let me give you a few pointers. You might want to write all this down. Let's talk imaging. I see you're recruiting older people and midlifers. You have a pretty diverse group of photos, but none of them are depicting people with disabilities. So if I don't see any people with disabilities on the flyer, I'm assuming you're not prepared to work with people like me. What? Am I supposed to call a number to find out about a program that I may or may not be interested in? So are y'all recruiting me, or am I recruiting myself? If you don't have access to inclusive imaging, you can at least change the wording. Time for point 2. Accessibility. Don't talk about being accessible without being sure that you are. Is your parking accessible? Can someone get in your facility or get dropped off? Is your entrance accessible? Do you have automatic doors? Do you have accessible scales? Do you have a knowledgeable staff? Do you have accessible classrooms and meeting spaces? Is your restroom accessible? Okay, now let's talk outreach. How am I supposed to read this on this small print? And I see you have another one put up there upstairs on that walking track, but okay, come in, closer. Closer, closer. How am I supposed to read this and get up on that walking track when I can't even get up there? That's pointless. Tell me who you were trying to recruit again? Certainly not me, because people with a disability cannot see this or that. If you want something that people with disability can see, you need to put it in a place that they can be. Are you sure you're taking notes? Okay, last point, affordability. If you really want me to participate, you have to make sure it's affordable. If I can't access everything, or if my disability prevents me from accessing everything, then you shouldn't expect me to pay full price. By the way, while you were jotting down those notes, I told my friend Deborah about it. She signed up too. We'll see you in class.
I love that video. I love how he just says it like it is. All right.
All right, I'll try to go through these remaining slides here pretty quick, but that was a video that we produced, and we have a videography team. That was actually shot at the Lakeshore Foundation. So that was the background that you were seeing. Now we're going to kind of get into some of the resources that and we're going to continue to do that as we go through the rest of the day. We're going to get into one of the resources that we have that I think will help you understand what level you're at in terms of the inclusion of your program. And we have a tool called the Community Health Inclusion Index, or the CHI, and it is a multi-level tool that is validated and tested. It's part of a research project. And it basically allows you to measure different levels of inclusion. It's not about ADA compliance or any kind of compliance. It's measuring inclusion. So it looks at things that are related to what's required under ADA, but goes beyond that as well. So we have a macro level tool that looks at, so community level issues. We have an organizational level tool that actually looks at things like staff training and how well your organization is prepared to be inclusive. And then we have an on-site tool that is really focused on more of the nuts and bolts of the built environment, and looks at parking and public transportation and restrooms and assistive technology and what's available there. So that is available on our website. We invite you to use it. It is available free of charge, as is everything else on the NCPAD website. Another issue to pay attention to is transportation. Really, the important part here is to really be more familiar with the accessible options in your community, and also be aware of the fact that some transportation systems just take a long time to get people from point A to point B. And so understanding, that for when we get back to, the point where we're doing in-person classes more, it may take someone a couple hours or an hour or, to get from their house to the program site. And so you need to be aware of that and how long the transportation system takes. So just some things to think about in terms of transportation. Very big, very common barrier for people with disabilities. Planning ahead also means arranging for accommodations. And we talked about partnership earlier. This is one of the reasons why you partner with disability organizations. But when you have your registration process, you need to be asking, do people need accommodations for, whatever a particular kind of disability? And there are 6 questions that are actually part of any kind of health disparity survey that the federal government does that you can use to identify people with disabilities, and then ask them, what kind of accommodations they need. And that can be, if we go back to the grades domains, that can be anything from equipment and technology, or, it could be part of the instruction and extra time, or, it could be a variety of things. So making sure that you ask when you do your registration, ask if people need accommodations. Very, very important. Here's the accessible scale. I apologize, I don't know why that one's blue, but we do have a better picture than that. But we put this in here. Typically what Rebecca and I are talking about is the diabetes prevention program, which is a weight loss program. So if you have a weight loss program and you're measuring people's weight on a regular basis, you need to have an accessible scale, a wheelchair accessible scale. I put this in here, and particularly as part of the discussion about planning ahead, because obviously this is not always a cheap, this isn't a cheap item. And so it is something that you need to plan ahead for and budget for. And we've actually been doing some other work with a few other states in the diabetes prevention program, and they've been able to sort of barter and find accessible scales in their county. So sometimes it takes creativity to find a scale, but if you have a weight loss program and you're measuring people's weight, you have to have the accessible scale. They do, they're not cheap. They do cost, I would say, probably a cheap one is probably $2,000. I've seen $3,000 to $5,000, $6,000 on average. Depends on, the different bells and whistles and whether or not it's portable or how portable it is. But basically you can go online and sort of do your shopping there for that particular item. But again, really important to provide, even if it is expensive, if it's integral to running an inclusive program, you have to be able to purchase it. Next, please. Other common adaptations for almost any program: assisting participants with filling out worksheets or food logs or exercise logs, doing an accessibility survey to check the built environment, assistive technology, alternate formats, using effective communication, offering supplemental resources. Maybe if somebody has a caregiver, they need to have the same information that you're sharing with the individual, and maybe offering some resources to caregivers is going to be helpful if somebody doesn't do, for example, the cooking or the shopping or the meal preparation in their household. Next slide, please.
So this is a great example of supplemental resources. We oftentimes, in working in health promotion programs, have specific evaluation requirements that are written by someone at a federal level, right, that are not as accessible to any of our participants. So these are some great examples of ways that we can infuse universal design and graphic imagery to help individuals understand what's being asked of them, as well as giving them the opportunity to be able to have a conversation with you or even point at pictures if they need to be able to answer. So just a great way to think through those resources.
And as I said, if somebody has a caregiver that they rely on for transportation or for food preparation, shopping, meals, include them, and include that individual support system to the extent that's necessary, so that they can be supported in making healthy choices in their daily lives. So providing the same information to caregivers that you provide to your participants may be something you need to do. So something to think about.
Great. So, oh, go ahead before I.
No, it's okay.
Okay, I was just gonna say, we will go ahead then and start our break. We were gonna jump into virtual accessibility, but I think that's a good one to start with when we come back. So we are gonna give y'all 15 to 20 minutes. So let's say it's 11:25. So let's say, I don't know, what do y'all think, 15 or 20? So we'll come back, we'll shoot for between 11:40 and 11:45 to be back and get going. So we encourage you all, go grab some food, feel free to walk, roll, stroll if you need to, stretch, and we will be back here at, and we'll be back here at 11:45 to get started. And if you have any questions in the meantime and you're gonna eat lunch with us, that's great. Just we can have a conversation in the chat if you'd like. So feel free, and we'll see you back here in about 15 minutes. Hello, everyone. We are going to get started here in about 4 minutes. If you want to make your way back. Again, we can't see you. So if you're eating, feel free to just keep bringing your lunch. We'll never know. So we'll just get started here in about 4 minutes. All right, great discussion going on in the chat. Yeah, and I think that's I think this kind of demonstrates the whole concept that the stuff making things accessible isn't always easy. Got to get creative. All right. So, excuse me, one thing that I did want to go back to really quickly that Chris had mentioned, but we want to, excuse me, pull out a little bit more is the second bullet here about standard questions for collecting disability demographics. So I put the links in the chat and I can paste them if needed. But basically there is a set of 6 standardized disability demographic questions that required by law, any organization that is receiving full or partial funding from Health and Human Services is actually required to have those 6 questions on any health survey that they do. Most people probably don't know that, but also, aside from the legal compliance, it really helps our field gather information about health disparities focused by people with disabilities, because historically people with disabilities are left out of research and data collection. So not only will it, go fulfill the legal compliance, but as Chris said, we don't want to stop there. It really does help us learn more about programs and ways that we can be accessible and barriers experienced. So again, the links are in the chat, but if you have any more questions about that, feel free. Okay. All right, we are going to switch gears a little bit to accessibility in a virtual world, which I think is something that is extremely hot topic right now, given the COVID world that we're living in, and almost everything has had to transfer over to a virtual platform. And we've got tons of questions since the pandemic started a year ago about things related to this. So I'm going to turn it over to Lindsay and Austin first to talk about some of the awesome resources that we have created.
Yeah, so this is a resource that the Kentucky Inclusive Health Collaborative created in collaboration with New York's State Disability and Health Program in response to, we were getting ready to pilot a health promotion program in the virtual world that COVID has thrust us all into. And we discovered that there really wasn't very many resources on how to make virtual environments accessible, but we even getting even more specific resources on virtual programming or events. So we decided, well, there's a need and we are going to create this resource. And so it is designed based off the game of life. It's called the Game of Live, which is live inclusive virtual events and programs. And it's interactive. We're going through one more stage of edits, so it's not quite finalized, but we wanted to share it with you today. And it's interactive in the sense that you can click different areas and additional information will pop up, and then you get down to the game board and it takes you on this journey of all the things you need to consider or have in place as you plan a virtual event, program, or meeting, of things to think about. And we really wanted to have this resource be a thought-provoking resource and be a place that individuals who are new to inclusion or have been doing inclusion for a long time, but this virtual space is harder to navigate, and thinking about the creative ways we can offer accessible, inclusive virtual programs and events. And so it's a very short, concise, bits of information to get you thinking. And then there are some modals that actually take you to more detailed resources and information. But we wanted this to kind of be a place to get you started and then to connect you to additional resources. And so and then we have more like overarching resources that just talk about accessibility in general. So not necessarily specific to virtual programming and events, but just thinking about some things that might be applicable, in person might also be applicable in a virtual setting. And I'll let Lindsay talk a little bit more about this.
So as a program planner, this is where I identified as the gaps, where we actually hosted a virtual health promotion program over this past fall. And this is really a lot of the lived experience that we had from trying to do that in support of an American Heart Association program. And we incorporated that lived experience, a lot of the information, those external resources that Austin shared. Some of them are 40-page documents. So trying to pull out those main points to put in this concise format for you all. And then also too, it was reviewed by a very diverse panel of individuals that included health professionals, varying individuals with disabilities. We also had a contact with individuals that are English as second learning language, the facilitator for those programs, as well as some other participants. So we have a strong health literacy lens. So this is hopefully a helpful resource tool for you all to use in thinking about those things that it takes to program plan an actual event in a live and virtual setting, more so than a meeting, and thinking about the external factors that would be playing into that.
And one of the resources we actually reference is NICPads. And so we will turn it over to them so they can talk more specifically about their resource.
Thank you. And that's such a cool resource that you all have. I'm excited to check it out. Another resource that we have for you is on NICPad's website. It's our small toolkit called Hosting Inclusive Virtual Wellness Activities. So inside this guide, you get tips and reminders to consider when you're teaching an online class. And teaching in that virtual setting, because this is the world that we live in these days, and those telehealth and virtual learning opportunities are obviously becoming more and more common. So gratefully, we have some opportunities to learn how to be inclusive while teaching online. Some simple tips in this little guidebook might include ensuring that captioning is on while you're speaking, or if you're in a well-lit area, making sure that lighting is shown well on your face in case somebody is trying to read your lips. So short tips like that. It would also include things such as being as descriptive as possible with instructions. So if, for instance, you're leading an exercise class online, being as descriptive as possible as you're describing the movements that you're doing. So your lighting, speakers, videos, instructions, those are all key items to consider when you are preparing to host a class with participants. Next slide. And then we had mentioned briefly a few slides back before break, but this is the link for NCPAD's CHI, or the Community Health Inclusion Index, as well as the ADA's checklist. So we wanted to make sure that y'all have these links as well to reference back to. So both of these accessibility surveys are tools that you can use to help you identify barriers and ensure an accessible location or program and get you started. Of course, remember the ADA is a good beginning step, but we want to move towards that universal learning and that universal opportunity for everybody. And so there are local resources and assistive programs in Kentucky as well. The Kentucky Assistive Technology Services Network website can also support you in your inclusion efforts as well. So I encourage you to check that out too. Some of the slides coming up a little bit later will be some great information about equipment and additional resources. So this will definitely be a link that you'll want to keep handy.
And like I said, we will make sure that to all of the people that are registered, we'll send out a PDF of the slides, so you have all of the links and resources that we've been talking about. So now we're going to transition in to NCPAD mainly is going to speak on specific strategies related to physical activity and nutrition. I'll turn it over to Chris.
Yeah, so now we're going to dive into even more of the resources that NCPAD has. That's probably going to be the most interesting part, to be honest, but we did want to provide you with some foundational information, regardless of your role, about physical activity and nutrition for people with disabilities. Just some basic tips to understand so that you have, again, that foundation to get somebody started in getting into a more active lifestyle. And again, nutrition, physical activity, that is NCPAD's wheelhouse. So, but basically you want to start off with the assumption that everybody can get, or you want to try to get everyone as close to 150 minutes of cardio per week, and then strength training 2 to 3 times per week. That's a general good recommendation for anyone trying to get more activity into their day. Now, for individuals who can't meet that recommendation, and there are individuals out there, of course, just as much activity as possible is the good rule of thumb. And so, again, just kind of starting from that basic information there. In terms of how to exercise and what to do, obviously, as we said in the previous slide, you want to focus on both cardiovascular training and strength training. So cardiovascular can be anything that gets your heart rate up: walking, pushing, arm, legs, bike, or an arm or leg bike, arm ergometer, as some people call it, a rowing machine, swimming, dancing, anything that gets your heart rate up, that's cardio. And strength training, anything, lifting weights. And we're going to talk a little bit about some creative ways to do that in your own home if you don't have the equipment to do it. But also just to make sure that you focus on upper body, lower body, and your core strength. We can go to the next slide. We're going to talk a little bit about intensity. And that's basically how hard you're working, of course. And sort of that sweet spot is right in the middle. That's what we want everybody to be aiming for. It's that moderate level of activity, which is small increases in breath and heart rate. If you get into vigorous activity, that's the large increases in breath and heart rate. And that's, if we're exercising so much that, we're going to talk about the talk test in a second. If we're exercising so much we can't talk, that's too much. So when we're talking about getting people with disabilities active, getting anyone active, that moderate level of activity is a good sweet spot, especially for someone who hasn't been active previously. And then, of course, light activity, we want to, if they're at that level, we want to kind of step it up a little bit. Next, please. Again, different ways you can measure intensity, the talk test. If you're doing light activity, you should be able to sing. If you're performing moderate level activity, you should be able to carry on a conversation. And high level of activity, you should be out of breath, basically. And again, that sweet spot is in the middle. If you can't carry on a conversation, especially if you're somebody who's not used to being active, you want to slow it down a little bit and hit that moderate level. Next, please.
And one thing, just before we keep going, there's a good question in the chat. Basically, how to safely recommend exercise to people with disabilities or chronic conditions such as kidney failure or hypertension. So with individuals like that who have those certain chronic conditions, there's definitely most of the time like intake forms that you'll be able to use or a physician should use to assess like their ability and safety to engage in physical activity. But then from there, there's tons of great resources. I specifically was taught using the American College of Sport Medicine recommendations, and they have general physical activity recommendations and considerations for pretty much any chronic condition, like you're mentioning hypertension or kidney failure. So, definitely knowing person's limitations and being mindful of their safety should be first and foremost, and then making sure you're looking at reputable resources for those types of conditions to know how to recommend that safely.
And NICMED has on our website a section called articles, and that's basically different categories of articles, and specifically things like if you want to know how someone with a certain kind of condition like kidney disease or something like that should be exercising, there's an article for that. We have a whole list of different conditions. We have a whole list of different activities. So kind of the other side of the coin. If you want to learn how to adapt basketball, for example, for someone, there's an article on basketball and they'll walk you through how to do that for someone with any kind of disability. And so, and then we have a number of articles on a variety of other topics, research, a lot of different pieces of information that I think you could tap into. Next, please.
This next one is for a rate of perceived exertion. So a Borg rating scale is something very commonly used to gauge physical activity, especially when you're working in a health promotion program, so that individuals can see where they feel that they fall on that perceived exertion from what their perception is. And so the image on the left is a really great example of a Borg chart from a Health Matters program, which was evidence-based for individuals with intellectual and developmental disabilities. And what's great about that is that it's easy for participants to identify and engage in that intensity level in a way in those multiple methods that works for them. So you can see on the left there, it follows with the general heart rate with adding a 0 or multiplying by 10 to see, our resting heart rate is going to be in that light green area. And again, going back to what Danielle was saying, having the yellow as the middle section, and then the red is the more intense area. That's pretty common for adding color schemes to a lot of our health promotion messaging. And then the verbiage there talks about going from very, very light to fairly light to hard to very hard. So you've also got that way to visually see it. And then the clip art images have something from a woman walking comfortably to a little bit more exertion. She's definitely running to, in the red zone, that woman, I like to say, has a grimace on her face, her hat's flying off, and she's reaching as far as she can with her arms and legs. And so that's a great way for your participants to be able to see how it is that they feel that they're exerting themselves for physical activity and where it could fall. And we've even used this with a group of autistic individuals who are able to have the picture, their own picture that they placed on a printed Borg chart so that they could show us how they felt like that they were exerting themselves. And as a facilitator, it helps me to recognize that, especially if someone's not familiar with physical activity or how that makes their body feel, they might put themselves in that red zone when I know that their heart rate's really only beating at 90 beats per minute. So a really helpful tool in utilizing physical activity as a part of a facilitator.
All right. I don't want to spend too much time on this slide, but I think, checking your pulse and understanding, that making sure your folks understand how to do that is important. This slide talks about the Carvonen method to measure your target heart rate. I think that maybe gets a little too complicated and perhaps outside of the scope of what a diabetes prevention program or chronic disease program trainer would do. But again, just checking your pulse. I think actually next slide, we talk a little bit about some ways to do that. So obviously, you know, checking your pulse for 6 seconds out of 0, that's your beats per minute. And just making sure people understand how to do that, and where they, you know, how they're supposed to feel in terms of that, that sweet spot, that moderate level of physical activity. Next slide. Another rule for exercising safely and thinking about progression and how your exercise program should be progressing. Actually, you can go to the next slide. It's called the 10% rule. And basically, if participants feel like they are not getting the same benefit out of their current level of activity, then they raise that either duration or intensity of that activity 10%. So if you're walking 10 minutes a week and you're finding it's not giving you the same benefit, add a minute every week, or add a minute in the next week. You know, so 10%, add 10% more. Just a general rule of thumb for people, anyone really, but people with disabilities, particularly if you haven't, again, been involved in physical activity very much previous to being in the program. That's just a good, safe rule to follow. Next, please.
Thanks. So something that we created a while back, which is actually currently undergoing like a facelift and a redesign, is our physical activity tip sheet. And so this was really something that we created in response to when working with a certain healthcare professional. We were helping her adapt some of her resources and some of her verbiage and the way she talks about things in a more accessible manner. And as she was presenting to us, we had Morgan in the room, and then we had a colleague, Cody, who is a wheelchair user. And she's talking, giving her spiel, and she goes, you know, when it comes to physical activity, we really recommend 10,000 steps per day. And then she paused, and then she looked at Cody, who's in a wheelchair, and she said, okay, I need to find a better way to talk about physical activity because steps aren't going to cut it for everybody. So we then worked to create this physical activity tip sheet, which on the front has the basic recommendations that Chris just went over. But then on the back, we talk about alternatives to pedometers. And actually, we pulled a lot of this information from NICPAD, but basically providing you know, different places that an individual can put a pedometer based on, you know, wheelchair use, and feel free to, Chris, jump in with if you have anything to add with that. But also there's different apps out there. And I think the Apple Watch might even have it now, where you can put on a wheelchair mode, and instead of counting steps, it can count wheelchair pushes or general minutes, which is the, you know, the kind of gold standard is assessing activity in minutes per week. So there's lots of ways to talk about physical activity and measure it in more adaptive, accessible manner.
And Danielle, with the pedometers too, you can put those anywhere. Now, you can put them on your ankle, you can put them on your wrists, you can put, you know, it doesn't have to be necessarily on your waist, as long as it's measuring movement, maybe not necessarily steps, but movement. And yes, the Apple Watch does have a software that measures not steps, but exercise for wheelchair users. And it's the Series 3 or better or higher. We were actually fortunate in Lakeshore to participate in the testing of that product. So,
and your phone also,
Right.
you don't, there's an app on your phone. You don't even have to click on it or anything. It just like does your steps. I didn't know that.
Yeah, so thinking about, you know, even though those apps may be reporting steps, it doesn't really matter what it is. Just going through a normal day and using that as a baseline, and then working to increase from there, even if it doesn't necessarily correlate exactly to steps. But yeah, so, and like I said, we are creating a new resource, a new version of this, which is actually going to be broken down by age groups as well. So putting a little plug in there, that'll be forthcoming as well.
As a program planner and working to support individuals with disabilities and being able to be physically active, one of the greatest barriers that we've experienced is costs or even access to equipment or facilities. And so one of our successful ways to overcome that barrier has been making homemade weights, which is obviously inexpensive. We're also helping the environment by recycling and reusing empty bottles. It's also a fun activity to be able to create those because we're filling them with sand or rocks or different types of materials. One time we did a 2-pound weight and a 5-pound weight. So we had to add a little math activity in there, depending on how we were going to fill the bottles. And then we decorated them. And so we used different colored tape to identify which ones were which types of weight. And the also neat thing about being able to use the different bottles is if you think about a Gatorade bottle, it has those grooves in it that are helpful for someone who might have dexterity issues to be able to hold on to the bottle a little better, or we've used half-gallon jugs. So having the handles and being able to use that is a little bit easier for some people as well. And you're using those as resistance and strength training equipment that are something simple and easy to do. And we can also do that virtually by leading an activity and having individuals use whatever they have at home to create those homemade weights. And then they get to take ownership of that and use them in their own home for their exercise and physical activity training. This is a list of barriers to physical activity that comes from the CDC, talking about the physical activity barriers that individuals with disabilities experience. So I think if you look at these are all wonderful barriers that we all experience, whether we experience disability or not, knowing that finding the time is often the first excuse for being able to be active. And then having social support is really important, to be able to have someone who holds you accountable or encourages you and provides that motivation for you to be successful. And then lack of energy, which my caveat to that is the research shows that the more active we are, the more energy we have, which I can say that, but I don't necessarily always live by that rule. But it's definitely an important one to think about, because that goes into motivation as well. If we're not motivated, or what is it that motivates someone to be physically active, and how strong of that motivating factor could be. Fear of injury is another one, especially for individuals with disabilities that we serve. If they are, like I said before, not comfortable, confident, or have that self-efficacy when it comes to physical activity, so they might not have these skills and experience and knowledge. And then also too, maybe because of their disability or a secondary condition, or maybe they've experienced an injury before, that also gives them more of a fear in being active. And then again, the lack of skill, knowledge, or resources that you as a program and facilitator could help encourage them to increase. And then lack of resources, which we talked about as a recurring theme about transportation and cost, and being able to access resources that are inclusive is another big barrier.
That's great. So before we move on, there's a couple of great things in the chat that I want to highlight. Colin said, people don't realize that often also intellectual or cognitive disabilities can be a barrier to exercising as well. And I think that goes back to everything that we previously said in the ways about talking about physical activity in a very simplified layman's terms, like what Chris was saying about measuring your heart rate is exactly right. So you're right on there. Chronic illness can be a barrier. Yes, I absolutely understand that. As somebody, like I said, with type 1 diabetes, oh gosh, sometimes my blood sugar is just not where it should be to exercise. And I'm like, I just can't today. And that's definitely part of it. So I think going back to, again, what Chris had said is doing what a person is able to do, right? Setting your own goals. And if they can't meet quote unquote recommendations, building their own and making it work for them. And poverty, exactly. That goes back to access as well. And then weather. Yep, weather is a huge barrier. Absolutely. Yep. These are great. These are great ideas. All right. So next we have another video from Nick Pat about choosing a fitness facility. Go ahead, Chris, if you want to intro it.
Yeah, this is just from our video library and highlights Mary Allison Cook, who's a former Paralympian. And Danielle, if you don't want to play the whole thing, it's some sort of long, but basically it's exactly what the title says. It's about choosing a fitness center and developing the self-advocacy skills to ask for what you need when you go to a fitness gym.
I'll play 1 or 2 minutes. Am I sharing? No, I'm not.
Becoming physically active can be a challenge, and the first step to that challenge is finding the right fitness center that meets your needs and desires. So today, we're going to walk you through the process, give you some good questions to ask, and take you on a tour of a fitness facility. So come on, let's go check it out.
Before you visit a potential fitness center, it's important to consider its location, cost,
hours of operation, and what features it offers. Once you have narrowed down a few gyms, it's time to take the all-important tour. Most gyms will offer free tours led by a staff member. When arriving at the fitness center, it's important to assess the outside of the facility as well as the inside. Is there ample accessible parking? Are there curb cuts? Is the parking lot level? Once you enter the fitness center, pay close attention to every aspect of the facility and walk through the building just like you would if you were there to work out.
Nice to meet you. How can I help you today?
I'm here. I'm interested in joining your fitness center.
Anything in particular you're interested in?
I would like to use your equipment and machines, but also interested in the different classes that you offer, and how inclusive they might be for me with my disability.
Okay, we have a wide variety of classes that are located throughout the building. As we take a look around, we'll be able to see how inclusive.
Yeah, so we can definitely, again, we'll set out, but I think that could also be really helpful too, if you have a participant who's a wheelchair user, and what are some questions that I should ask when I'm looking for a gym? So having that basic knowledge.
Here's a great success story of being able to partner with a YMCA in Bourbon County. So we worked with them to want to create an inclusive fitness program, and then the pandemic happened. And so we pivoted. They actually received a micro grant, from NCPAD to be able to implement an inclusive fitness program. And we were able to offer it electronically, virtually, and we called it Fitness for All and Heightened Fitness. And so this past week was actually our last week of offering 2 classes a week for 30 minutes with the Silver Sneakers instructor. It was a really great opportunity for individuals who can join, and it was inclusive because it was offered to anybody in the state. All individuals that we are connected through our disability organizations were invited. Anybody that was a member of the Y could join. It was really an incredible opportunity for people to come together and get to move their bodies. And the great thing for the instructors was learning about how to do some of the things that we've talked about so far today, and making that inclusive for having someone showing a standing versus a seated position, and the individual seated was also making sure to always move her arms in case it was just a activity that included only foot movements. And so really great opportunity. And the cool thing about it is that we are offering a survey to see if people are interested in continuing this program. So definitely keep in touch with us and then follow us on our social media, and we'll share all those contacts, because it should hopefully be a continued resource for Kentucky participants to be able to do in the coming future. This next video is an example of adaptive videos that we created in partnership with the University of Kentucky's Extension Office and their Fit Blue program. So I'm going to let Danielle showcase this little short video. They're all 20 seconds or less, and highlight 3 different ways to modify that exercise. It's a really great way for making it inclusive.
Stand or sit upright, holding a weight in the center of your body in line with your belly button, or just clasp your hands together. The elbows should be bent and tucked in close to the body. Keeping your feet in place, chest tall and shoulders facing forward, lean back slightly and rotate your hands to one side until you feel a comfortable stretch in the muscles of your core. Pause and then slowly return back to the center and return to the starting position. Repeat on the other side of the body, going from one side to the other with a slow, controlled movement.
What I love about this video, is that we're showing a diversity in age, disability, race. We're showing different types of ways to use fitness equipment. And so that's our way that we created all of these videos. There's over 22 of them. And Morgan, you were going to say something about the
Nope, you said exactly what I was going to say. That's why I like the videos. Is because they show 3 different versions of how to do it. Maybe someone has a hard time getting down to the ground and doing it, and someone might be in a wheelchair. And then so that's why I like our videos.
Yeah, absolutely. And the great thing about those videos is they are housed on our YouTube channel, but also we created them in partnership for the Fit Blue app, which is through Extension. So that's something that you can download or have your participants download. That's a part of any app store. And it's a nutrition and physical activity tracker that was developed to try to aimed at lowering Kentucky's rates of obesity. And so it's more than just a fitness tracker though, because it talks about how to access your local farmer's market. There's a food bank locator, workout plans that coordinate to those videos that we showed. And the videos that we have are not all the videos that are housed in this app. There is a lot of other videos. We just recognize that the actress in the video is a former collegiate athlete, and not everybody can move their body, right, in the same way. So we were excited to be able to offer these adaptive videos as a part of that. The next slide showcases our YouTube channel and talks about additional videos that we have. So the ones for FitBlue app are 30 seconds or less, and so they're much shorter, but we recognize some people need more information or to have additional information in detail about how to do those exercises. And so these are all roughly about 3 minutes or less, and they highlight self-advocates from across the state of Kentucky showing the ways that they do those exercises and whatever works for them and their bodies, which is really incredible. We are really happy to be able to do these resources as well. I think the next slide just showcases a little bit, if we want to show just a couple seconds of what that looks like. Yep.
Hi, I'm Mark Abel, Associate Professor of Kinesiology at the University of Kentucky. I have experience in designing resistance training programs for a variety of populations. In addition, I've taught a number of academic courses in exercise program design. This video is an introduction to a series of educational exercise videos to enhance physical activity in individuals with varied ability levels. This resource is a product of Project Cheer, a Centers for Disease Control, Disability, and Health Branch funded initiative with partnerships at the Department of Behavioral Health Division for Development.
You can stop if you want, Danielle. But yeah, as you guys can just already see, we have a lot of great different variety of actors in there. And we went to different locations across the state. We traveled to the Owensboro waterfront, which is one of my favorite areas that we filmed some of these videos as we were outside in parks. And so really great resources for you guys to be able to reference. And Morgan's going to talk about another resource we have for you, which is our comic book, Disability Don't Mean Can't, in partnership with Disability Don't Mean Can't and DDMC Man.
Yes, there's, we have our own comic book. They're all real actors. And I like this because, and there's an actual comic book, and then there's, if you go to our website, there's a kind of like voiceover kind of. But I like this because, like I said, they're real actors and facing other obstacles people with disabilities face, like real obstacles. Like one is, I didn't get invited to a sleepover or something, or I'm trying to learn how to cook and then I'm in it too. So I just like this comic book because, like I said, just a bunch of different obstacles and how people with disabilities overcome them.
Another great resource that we've been able to provide through our efforts is the Kentucky Recreation Resource Guide. And this is accessible on our website, and it is something that we work hard to keep updated, but recognizing that's always a changing world. So make sure to come back often for more updates, but this is things for accessible recreation within the state of Kentucky, but also references national organizations for individuals to be able to get involved in. And what I love about this resource is that it doesn't just think about, you know, like the wheelchair basketball program, or we have sled hockey, those kinds of things, but also to a broader definition of recreation. So thinking about art as wellness, and in addition to going hiking, and where are some local places in Kentucky that have accessible trails, those kinds of things. And so great resource tool for places that we can get active inclusively in our own backyard.
Okay, so now we're going to dive into a little bit more about that NICPAD has on our website. And again, all of these are free of charge. Some of them, I'll explain, but some of them do require you to set up a an account, but they're all online. So starting up at the top left, the Champions RX is an online physical activity program for individuals who have are a little bit more advanced and have a little bit more experience with physical activity. So it's a sort of self-guided physical activity program, provides videos and suggestions for different kinds of higher intensity physical activity. Inclusive yoga is another resource. Obviously, it's on yoga. It's on our YouTube channel, and we have a pretty good social media presence. So we do have a YouTube page. We do have a Facebook page. We do have Instagram. I think we're on pretty much all of the sort of major ones. Pinterest, I know we have a page there. So iFit Tips is another series of different video exercises, the sort of demonstration videos of different exercises, and particularly for individuals with physical disabilities. Discover Accessible Fitness is more about the accessibility of different kinds of fitness equipment. One I really want to highlight for folks is the small blue link in the middle of there we go. Yeah, it's 14 Weeks to a Healthier You is a guided physical activity and nutrition online program for individuals with disabilities. And it's for anyone, even if you've not had a lot of experience with disability or with physical activity. What you do is you can go to the 14 Weeks website, sign up. You provide us with different kinds of information about your physical activity, history, and nutrition, and a little bit about your disability. And then you get in return customized exercise suggestions and nutrition suggestions. And so that's a monitored and moderated program, 14 weeks. Yes, it is free. You just have to sign. That is one that you have to sign up for. You have to create sort of an account with a username. All of these things, all of our publications and resources are free because we're federally funded. The how-to video series really covers a variety of topics, anything from, I think there's one about, wheelchair transfers and cleaning your chair and I think there's something about adapted driving. So we have a variety of videos in that series. Get the Facts is just kind of a little bit more in-depth publication about what physical activity is, what makes good physical activity, some rules to follow, and some ideas, some general ideas if you have a disability. Life on Wheels is obviously focused on individuals with who are wheelchair users, physical activity and nutrition tips and strategies there. And this is just a sampling. You can go to the next slide, I guess, Danielle. I don't know if we have anything else. Yeah. We do have a focus on inclusive worksite wellness for those of you interested in that. Deskercise on the left there is it's a poster on exercises you can do at your desk at work. And then the one on the right is about how to burn 100 calories at work. So that's supporting our emphasis on inclusive worksite wellness. And next slide, please. So I'm going to turn it over to Rebecca, and this actually is a pretty entertaining section. We've got a lot of neat tools and tips that for nutrition education that I think could be useful to you.
Thank you. Hype them up, Chris. Hype them up. No, I always get pretty biased because I enjoy this part of the presentation too, obviously, because my background is in nutrition. So we're going to shift gears a little bit and go ahead and dive into some of these tips. So accessing healthy food is still a challenge for many families, particularly those living in low-income neighborhoods, communities of color, and rural areas. Guess what? This also includes people with disabilities. It's not that we're purposely excluding this population, but to get us thinking about how to make these communities more inclusive, we do continuously need to think about including. everybody. So people with disabilities are twice as likely to experience food insecurity than people without disabilities. And if you're not familiar, food insecurity is the state of being without reliable access to a sufficient quantity of affordable, nutritious food, meaning that the individual may struggle to put enough food on the table to eat each evening. 1 in 4 SNAP participants receive disability benefits, and 1 in 5 deaths globally are associated with poor diets. This meaning that chronic diseases may worsen by insufficient food or low food quality diets. So this is why it's so important to make sure that programs and venues are inclusive for all individuals to ensure good access to nutrition so that we can prevent those chronic diseases such as type 2 diabetes. Next slide. So while you're instructing your health promotion class, it's important to know that the room set up ahead of time and to remove some barriers and know your location. So that includes moving chairs and tables around to allow individuals to navigate freely. And y'all picked up pretty well on that on the Jamboard Kyle activity earlier. I'm noticing that tight classroom, the chairs, that individual might not have been able to navigate independently and freely in that classroom. This may also ensure good lighting and using a microphone, especially if you're teaching in an outdoor space or a large room, or of course, do have a participant hard of hearing. Using a mic is going to benefit everybody. Provide recipes with pictures to show the equipment needed or the action that needs to be completed. So you can see an example of this on your slide. Of a recipe card that includes pictures. So doing this can provide clarification for individuals who may have difficulty reading or understanding. So you can provide the recipe while you're performing the demonstration as well, so that that individual or the participants can also follow along. And finally, we always like to share that microwave friendly recipes can sometimes be the all-star for cooking accessibility, especially for beginners. So while we do want everybody to have access and be a semi-pro in every aspect of the kitchen, microwaves do decrease that risk of decrease the risk of burning yourself, and can also build that confidence for somebody, again, especially for somebody who may be a beginner in the kitchen.
And so going off of what Rebecca said about picture recipes, our team, as you saw in the mobile kitchen video, has created a series of picture recipes in partnership with different organizations. So our first series was, I think, 4 recipes for American Heart Association's mobile kitchen series. And then this past year, actually from, it made possible by funding from NICPAD and Rebecca, was our project, I don't even know what your title was, project officer.
I don't know
lead. Yeah, but basically we were able to partner with Nutrition Education Program that is at UK's Extension Office, who offers the SNAP Ed program called Healthy Choices for Everybody. And we were able to adapt the recipes that are in that SNAP Ed curriculum, which is targeted towards low-income individuals, and adapt them to be picture recipes like this. So I'll let Morgan speak a little bit about his experience with diving into this world of cooking and nutrition.
Thank you. So before being a model for the graphic recipes, I was not as comfortable with cooking in the kitchen just because recipes had a lot of words, and with hydrocephalus, I'm not the strongest reader as people my age should be. So I just get frustrated if I get stuck on a word. So, but now with these resources, it helps me because I am a visual learner as well. And it shows me the step-by-step on what to do. And now I am more confident cooking.
Thanks, Mel.
And that's a great success story too, of partnering with somebody and seeing what you can get out of that partnership. A few more tips on some teaching strategies. You can use participants as a volunteer so that you're literally teaching one-on-one in the class, or if you're able to, providing each person or assigning groups together to prepare the recipe and follow along with you as you are demonstrating. This way, the participants are actually already practicing the skills and building that confidence. And then you're able to answer any questions right there or correct, and just provide assistance while you are demonstrating and they're following along. This would also be a great spot to utilize a caregiver or a support person as well. As we've mentioned, they might be doing including them in the lessons or making sure that they understand the information as well, because they might be that person who is grocery shopping or cooking for that individual. So always think to include them as well, as what Chris was talking about earlier. And then finally, we know that taste testing is probably the best part of cooking demonstrations, right? Well, we want everybody to have that opportunity to see the food being prepped and then cooked, and then of course, taste it as well. So this might also help somebody discover a new healthy food to add into his or her meal planning. If you're able to, ask participants ahead of time if there are any food allergies or restrictions that they might need to avoid. So along with that, some individuals might have difficulty chewing or swallowing. And so these individuals may benefit from some type of food modification, such as soft, chopped, or pureed. So chopping up or using a blender to soften or puree something can be beneficial. But of course, always try and use nutrition professionals in that field if you do need some assistance. But of course, always asking ahead of time so that you can be readily prepared for your audience is going to be your go-to step. Next slide. So using food models as visuals is a great teaching tool. This enhances the learning for everybody. So the great thing about being in the nutrition field and educating is that a lot of the techniques we use are already inclusive because they're ones that support all learners. So that's people with and without disabilities. Food models or real food are great to show participants in class the correct serving sizes, and just imagine their food similar to what it might actually be. So imagining their food to that visual. Here on your slide, you can see that using your hands is a great technique. So one fist is about the size of one small piece of fruit, which is also the size of, or one serving of carbs, which is 15 grams. So using hand measurements is a great tool for participants to learn. And these are two other examples that you could use. So if you're not using your hands, using other objects that you can bring in and show. So physically showing your participants a deck of cards or the palm of your hand compared to the actual piece of meat in class, that would really enhance the learning. Or showing a baseball in class and comparing it to, for instance, a cup of strawberries would be a good demonstration as well. So maybe one baseball equals 1 cup of strawberries.
And then on this slide, this is actually a resource we created to help individuals with that visualizing, how much a serving is, because we always have, our hands with us. And there are handouts out there similar to this, but we incorporated that plain language and really wanting to make sure that the information was presented in a way that would be accessible to individuals. And I'll let Lindsay talk a little bit more about it.
Yeah, whenever Morgan and I are able to be in person and doing this presentation, we always hold our fists up next to each other. And Morgan is quite a bit taller than me, has a fist that's nowhere near as petite as mine. So being able to showcase that we're also individualizing the health messages that we're giving by talking about using your hands as a great example is another way to think about that and thinking about supporting someone and their individual needs. And we love that this particular handout thinks about that it can be a serving size, and you're thinking about how, the clenched fist is 1 cup or a serving of fruit, but that's also going to look a little bit different between Morgan and myself.
Yeah, our hands are meant, like our bodies are proportioned to measure for ourselves. It's kind of what we always say. So moving on, we're going to talk a little bit about some adapted utensils and tools. So some tools in the kitchen that can make the cooking and eating experience less intimidating and more independently are adapted tools and utensils. So there are several examples on your slide, and I want to run through them briefly so to educate you on them and then see who they might be able to benefit. So the top left, the white swivel utensils, these assist users with little or no muscle control to keep the food to keep the food on the fork or spoon. So that tool swivels back and forth with movement to keep a level platform. The blue lipped plates, that's the top middle, those are commonly used by individuals with poor hand coordination. So the plate rounds up on the edges so that the consumer can scoop his food onto the utensil easier. Not shown on your slide is a pronged cutting board. So this is basically a cutting board that includes two little pricks or prongs that hold the food in place while one cuts. So this is especially great for somebody who might have one hand, and so those prongs will hold the food in place so they can still hold that there and then cut. Also not shown on your slide are non-skid mixing bowls or cutting boards. So those are useful for individuals with shaky hands. So that non-skid material allows for the cooking object or that cutting board to stay put and not slide around. The easy grip utensils, that is the top right, those include larger handles for easier gripping and can be weighted or non-weighted. If they're weighted, those are commonly used by individuals with Parkinson's disease or other conditions that include tremors to control unsteady hands while eating. The bottom left, those are finger loop utensils, and these consist of a small loop that slips over the thumb or pointer finger to ensure a proper hold. So these could be used by individuals who have little or no grip strength. The bottom middle is a spout cup, and these can be used by individuals who may have poor mouth control or spill frequently. So typically these types of cups have lids and the user will suck rather than drink their liquid. Similar with straws, so that individual, they may only benefit from drinking with a straw. A rocker knife, that's the last one on your slide in the bottom right. This is a larger knife that rocks back and forth rather than cutting and sawing the food. So this knife may be easier to use as the individual, or be easier to use for an individual prepping, so they don't have to pick up the utensil each time and saw, so it decreases the risk of cutting themselves. And then one final comment that's not on your slide, but openers, I think we're probably very familiar with them. They can come in a variety of tools, including manual or automatic. So many can be used to open jars, bottles, cans, and consist of grippers, corkscrews, and other mounted openers. There are mounted openers. Those can be typically nailed to a wall or a hard surface and be utilized by somebody who has one hand. And so, yes, if you're not too familiar, I always get the question of where can I find these utensils? Where can I purchase them? And actually, it's pretty simple. I always encourage just an online internet search. That's a simple, quick way to start, as well, as easy as that sounds. But you can also borrow or learn how to use them from rehab centers or occupational therapists as well. And again, another tie into reaching out to partners and seeing what connects you do have near you. These are great to use in cooking demonstrations as well. Another place you can tell your participants or your patients, your clients to check out and to borrow from would be your local assistive technology resource. Here in Alabama, where I live, we have a program called STAR, but in Kentucky, like I mentioned earlier, think back to that Kentucky Assistive Technology Service Network. That is a type of program that provides short-term loans of assistive technology to persons with disabilities who wish to try out different types of devices. So this can also go beyond adapted cooking tools as well, and check out adapted fitness equipment or other items that you might be interested in checking out. So those types of programs also provide alternative resources of financing to help people with disabilities purchase other assistive equipment as well. And then finally, if you don't have access to borrowing tools or are just needing a quick and inexpensive fix, some things you can do to create an easy, larger grip handle would be to cut a tennis ball almost all the way in half and stick the stem of the utensil on it for a larger handle. So you can see that they've done that with the picture on the slide. They have the tennis ball with a pen inside of it. There is also a washcloth or rag wrapped around the pen, or could be a utensil with just a rubber band. You could also, I've heard of people doing pool noodles as well. That's going to allow that much larger grip. Or trying to think of another example, and it doesn't always have to be just like a pen. It could be a rake that you're using outside for raking leaves, or maybe a broom as well. So again, these will make it easier for somebody who might not have that tight grip strength and has limited dexterity. So that larger grip is just going to allow them to hold that tool. Next slide.
So like Rebecca mentioned, there are resources out there, and in Kentucky, we have the Human Development Institute CAT Center, but we also have so that one's the one that is housed in Lexington, but we also have a couple other assistive technology centers throughout the state, and that is where you can check out equipment from the lending library. But we also, as in the Kentucky Inclusive Health Collaborative, created an adaptive kitchen equipment resource that is available on our website. And it just provides some examples and different adaptive kitchen equipment, as well as explains very briefly the purpose that they serve, and then provides a link for you to purchase them if you want through various websites. We do check it every few weeks to make sure that when the prices are changing or the links are changing, that gets updated so that you guys can all access the resources in one place versus having to search the large Google world. Morgan, do you want to add anything?
Just that I have used these utensils before while working with you guys, and I love using them because I have 3 fingers on my left hand. So gripping utensils or a cup or something, it's difficult sometimes to grip it, but now I can use this hand to cook as well, not just relying on my right hand all the time.
And what's so incredible about this particular resource is that through the NCPAD grant that we received to partner with our Extension Nutrition Education program and focusing on their SNAP Ed programming, we were able to purchase the adaptive kitchen kits regionally, so 8 of them across the state. And the items that you see there as a part of Morgan and I were working together to put the kits together. All of those items were reviewed by our advisory board, all of our community partners within Extension and within our Inclusive Health Collaborative. And so really thinking through making sure it was a comprehensive kit. And they were so well received by the Extension agents across the state that now Extension is working to buy these items in bulk, and there will be 90 kits distributed across the state of Kentucky so that Extension offices in the counties should be able to have access to these kits to be able to include for their programming that you could partner with, which would be an incredible way to access those resources and also just have an opportunity to get to try some of them out, right? Before purchasing them online, which is really incredible.
And this is another one of our NCPAD videos. We have 3 that go along with adapted tools and utensils. So this one specifically is about making your kitchen more accessible, maybe some inexpensive tips that you can do. And so I think if we have time, I think we're gonna show it.
My name is Sarah Belser. I'm the home management instructor for the Alabama Freedom Center. So in our kitchen, we have our stove top. Okay, this is our braille label to our stove. They're labeled from medium to low, medium, high, and we also have bump dots, which is where the off button is. They have the keypad numbered and brailled, that way they can adjust the heat temperature. These are from Walmart, like a $3 pair of measuring spoons. I just took a regular knife and I just made 4 notches in them. Just cut it down, super easy. And that way the students, they can take their finger and run it along the side and count how many notches are. And so they know this is the 1/4 spoon because there's 4 notches. So these are our measuring cups. We have 3 notches for 1/3 cup, 2 notches for 1/2 cup, and 1 notch for 1 cup. These are really inexpensive ways to adapt your kitchen and just make things more accessible to everyone. This is a gripper. This is great for if you have limited dexterity and you need to open certain things, you just simply put it on top of the bottle and twist. This is a jar opener. Squeeze it and it opens it easily. This is good for arthritis, limited dexterity, neuropathy from diabetes. This is a pull tab opener. You take the can opener, you put it on the pull top, pull it like that, then you turn it around, put it on again, and it opens the can. We braille label all of our spices. It says garlic powder. Now, if we have students that come in and they don't know their braille, we teach them to smell things. I always encourage all of my students to double check, to feel things, taste things, smell things, just to be 100% sure. So there's an app called Tap Tap See. So you take your phone, you can just wave it in front of the product. It will read garlic powder and it will read the brand and everything else on it. My main goal for this program is for each student that comes in that we equip them with every skill that they need. It really just allows each student to have that sense of independence and confidence that they can do anything that they want to do and they're not limited.
So that just gives you an idea of some things that you might be able to do in your kitchen, or just kind of expose you to some additional tips that you might be able to share with some individuals that you're working with. So the next set of slides, these next few slides that I have coming up are just some general tips that you might be able to share with participants who have a disability or may benefit anybody who is doing the cooking in the kitchen. And so these accessibility tips, they support individuals to best accommodate their own specific needs and their preferences. So for instance, and not shown on your slide here, but an example for someone who uses a wheelchair, that person may need to have may want a stovetop that has handles in the front rather than in the back, so that when they are cooking, they don't have to reach across the stovetop and risk burning themselves from the seated position. Sometimes the user may need to place the cutting board in their lap to cut, or work at a shorter table because that height of the table is more appropriate than the height of the countertop. You can see the difference of the two individuals in the pictures shown on the slide. So the person on the left the picture on the left that shows a person working at a countertop, while the picture on the right shows a man who is working at a shorter counter instead, or a shorter table. Also, the picture on the right, you can see in that top right corner, it might be a little bit small, but that is a picture of a flat griddle also being used. So you can plug this into a wall and use that on a shorter surface as well. So that also avoids using skillets and pans with handles that might accidentally be bumped. Next slide. So a few more tips, and these ones might especially benefit somebody who has vision loss and what could be helpful to them in the kitchen. So for instance, using contrasting colors with their food. So encouraging a purple onion on a white cutting board, that might be easier to distinguish. Maybe using tongs is easier to flip something rather than using a spatula. Or even in storage, using rubber bands to distinguish what types of canned goods might be in the pantry. So in this case, black beans can be identified with 2 rubber bands, and maybe canned corn could be identified with 1 rubber band. And then finally, one last tip to mention, and not on your slide, but you did see in the video, are label makers. Those can be really, really helpful in the kitchen as well. So Braille label makers are available, and that can help individuals navigate knobs and such in the kitchen. So knowing what spices they have and other ingredients. Next slide, thank you. And so in a cooking demo, adding an overhead mirror above the cooking space will allow the audience to see down on what you're doing at the counter. So that's not shown in the picture on the left, but that would definitely be helpful in that situation for the women doing the presenting the cooking demo. A mirror above the workstation should show where everybody can see and look down on what that instructor is doing and prepping at that counter. So that's going to benefit most audience members. On the right, that's an example of a mirror used in someone's kitchen, and this can benefit individuals who use a wheelchair or someone who might be short-statured. So adding a mirror to the back side of the stove and angling it towards the stovetop so that someone who is at the countertop height can see down into that pot that they're cooking into. So here you can see that that man is pouring a can of soup into a pot, and he can watch it warm up from that mirror on the backside. And of course, NCPAD has a wealth of resources. Of course, they're free. So here are a few of our nutrition resources that we have. The one on the left is our 5 meals, 1 bag. And this toolkit consists of a short video demonstrating how easy it is to go shopping and cook a meal at home, as well as include a month's worth of recipes. So the recipes can be used by anybody but they were specifically designed for individuals who may have limited function carrying bags or not a lot of experience cooking in the kitchen. The resource in the middle, excuse me, is our Inclusive Farmers Market brochure. So this is something that you can simply pass out to vendors and market locations to help make the area more inclusive of people with disabilities. We have 2 short videos that go along with this resource that Chris stars in some of them, so I highly encourage you to go check them out. But these videos, they promote access to nutrition and can be found on our website or on our YouTube channel. And then finally, the one on the right is our accessible gardening one-pager, which just shows information on adapting the garden, getting around the garden, some smooth pavements, what to consider when you're there. It also talks about adapting for the gardener. So that talks about adapted tools and utensils as well in the garden space. And then of course, maybe what types of flowers to put in your garden that might benefit somebody as well.
One question before we move on, I'll post to you, Rebecca, and actually maybe Lindsay, you have a good thing to say too, is there's a great question in the chat about adaptability on such things as reading a timer if people have difficulty telling time or estimating time.
I can go first, Rebecca, if you want.
Go ahead.
Yeah. So visual timers, it would be what would do as a programmer first to address that. So that would be the kind of visual timers, or when you turn it to 5 minutes, it showcases the one I have at home is blue, right? So then it's blue, and as it goes down to 4, 3, 2, 1, you can visually see that time decreasing. Another tool that I use is a sand timer, same concept. There's that visual showcase of how the time is being up. The difference there is that when a sand timer is done, there's no sound versus if you have a visual timer that's more like the turning one, you'll get that notification. So depending on what type of setting that you're using that for. And another way that we incorporate that into our universal design resources with our graphic recipes that Morgan and Danielle talked about earlier is for each of those steps, we have an example of that visual timer so that if it shows that 5 minutes, it's also representing what that looks like if I had turned it on that visual timer to help someone be able to know where to set that. So that would be a simple way to support that question. Rebecca, add?
Yeah, and I would add, those are great examples too. And I'm thinking off the top of my head, but one that's audible and like makes noise. So it's clicking, and then as you know, the time's running out, maybe it's beeping even faster. And I'm in my head, I'm thinking of a specific board game that I'm playing, and gets really anxious with the time counting down, but maybe something that's counting and making a noise can also be an example as well.
And Colin, you asked a question in the chat about if you cannot see or hear, a timer you could put on your wrist. And I'm not going to do it, but if I were to say, hey, Sally, set a timer for 5 minutes, then I would have that audible response. Oh, your timer's been set for 5 minutes. And then when the timer goes off, I'll get the vibration, on my watch or on my phone. So that would be a simple support tool that somebody would be able to do. I know there's other technologies like that.
The only other thing I would add is maybe we talked about that multiple format. So if folks maybe can't read an analog clock, providing a digital clock as well. So all those multiple methods.
Yeah. And some of the local nutrition resources, in addition to what NCPAD has shared, are through our website, or wellness4ky.org. That is what we have for our Kentucky Inclusive Health Collaborative. And some of the main ones that we have for that are through our partnership with NCPAD and the Extension Office. We have supported the SNAP-Ed programming, and the graphic recipes that are created for that effort are at the planeatmove.com website, as well as on our own website. And what's really incredible about that program for you all who are program facilitators is that the Healthy Choices for Everybody curriculum was accepted into the National SNAP-Ed Toolkit program. So if you're also partnering with the SNAP-Ed program and trying to implement your nutrition programming, that's something that we've been able to partner with to infuse universal design strategies into. And then our other program is in partnership with the American Heart Association, Aramark, and it's called Healthy for Life. And that's a health promotion program focused on empowering individuals to make healthy lifestyle choices with cooking. And we also have, there's 11 educational encounters for that we've been able to create inclusive and accessible PowerPoints, handouts, and even videos and resources to supplement that. And that's been a great opportunity. And what's cool about that is that it is free. You just go onto the Healthy for Life aspect of the website for American Heart Association and sign their non-disclosure agreement. You can access the Healthy for Life curriculum and begin to implement that. And all of those resources are accessible on our website. And then I'll let Austin talk about an external resource called Accessible Chef.
So Accessible Chef is just this very simple website that allows you to, or it just has a bunch of simple picture recipes. So it's just another place to find those graphic recipes in addition to the ones Lindsay shared, as well as what Rebecca shared.
Awesome. All right, we're gonna give you all about a 3-minute break. You need to hit the bathroom real quick after lunch, and then we are gonna bust through the last 30 minutes of this. So we'll be back at noon. I'm sorry, 1. 1 Eastern. All right, we'll get started here in just a minute. But yeah, Colin, I really like what you had said in the chat about video games. And that's something actually that Lindsay and I met a really interesting individual at a conference one time that was like beta testing different video games, like traditional video games, to like be inclusive of people with different sensory disabilities. But yeah, I agree. I think the more that you can make learning fun and interactive, like a video game, I think that's the way you'll get people engaged the most.
And Danielle, to that question too, one of the more interesting projects that our UAB Research Collaborative got involved in was active gaming and for people with disabilities. And so they designed a gaming platform for, I think it was maybe the Wii or, you know, the active gaming consoles for someone in a wheelchair to use. And so there are, and the project is called RecTech, but it's part of the UAB Research Collaborative that we have, or I think they've actually completed the project, but there's a lot of research going on in that field of gaming and physical activity and inclusion at Lakeshore.
That's awesome. Alrighty, so we are going to go through some tips and tools, and then we'll have one last like reflection discussion activity and allow for some questions. We will just pop right in. And Rebecca, I think this is you.
Okay, so just a few more resources from NCPAD that I think will be helpful to you. A little more broadly focused. Is this?
No, either one of y'all.
Yeah.
You.
Yeah, this is me. So we have a website called committoinclusion.org, and the basis of this website is it's originally was a global campaign to promote inclusion of people with disabilities in physical activity and public health and health promotion programs and policies. And at the foundation of it is 9 guidelines for disability inclusion. And then there's a guide or an actual manual that you can use to understand how to implement those 9 guidelines, but they cover things like including people with disabilities from the beginning of the implementation of your program. Communication, it talks about communication and providing effective and inclusive communication. It talks about program access. It talks about evaluation and process and outcomes evaluation and how that can be inclusive. So for your broader sort of different kinds of programs that you have, the 9 guidelines I think will be useful for you. Next, please. Part of the Commit to Inclusion website is also a campaign that we developed. As I mentioned earlier, we do a lot in the space of diabetes prevention, specifically the National Diabetes Prevention Program. So part of a grant that we have with the National Association of Chronic Disease Directors was to develop the Push for Your Health campaign. And it's basically an evergreen, permanent set of campaign materials that you can use to promote diabetes prevention and the National Diabetes Prevention Program for people with disabilities. So they have posters like the one that you see here, blog posts, different kinds of messaging. We have posters in English and Spanish. We have a video series that you saw a couple of those videos today that are related to diabetes, the campaign. So this is hashtag push for your health. All of this is free, or you can go to committoinclusion.org /push for your health, and 4 is FOR on the website. So I invite you to check that out. Okay, one of the newer features on our website is our learning management system, and it's elearn at nicpad.org. We have a variety of free, you do have to set up a profile like you did for the 14 weeks program that I mentioned earlier. So your email and a password. But the platform has a number of learning modules on a variety of topics related to health and wellness, physical activity, and nutrition for people with disabilities. Anything from general inclusion to worksite wellness, to nutrition. There's a variety of topics. Each of our 5 sectors that we cover has some kind of module in it. And you can also link to different tools that we have and different campaigns like the Push for Your Health. I do want to mention too, for those of you who are interested, and you can still sign up for this through the elearn.nicpad.org on the 30th and 31st of March, this month, next week. We are hosting what's called an inclusive fitness training workshop. And originally this was a workshop that we developed in partnership with the American College of Sports Medicine. And it was originally designed to teach personal trainers how to work with individuals with disabilities. What we've done with this one is open it up to a broader audience and to the public, basically. And so anyone can join, and it's basically been developed for an audience that goes beyond just exercise professionals. But it does still cover the topics of, accessible fitness and developing an inclusive, or developing a exercise program for people with disabilities, things like that. That's kind of the ultimate goal, but it is, it's been modified to be more inclusive of different kinds of professionals. So invite you to go to elearn.nicpad.org. You can still sign up for that. And again, it's all day, the 30th and 31st of March. Next, please. I'll let Kentucky talk about this part.
So these are some of the resources, some very broad ones that we typically recommend to people to get started or to get pointed in the right direction or get some of their really awesome resources. So NACHO, which is the National Association of County and City Health Officials, they actually have a specific disability focused section that they do a lot of great things with there. So that's more of like the public health side, which is great. The NICL, which is in the top right, which is the National Council for Independent Living. So this is the governing body for those state level centers for independent living. So this is a great place to go to if you're not sure where in your state or community there is a center for independent living. It will all be on their website. And then Human Development Institute, that's us. I already talked about that. There's, again, we don't just do health, we do employment, we do early childhood, we do like general healthcare, like there's a lot of different areas that folks in our department do. And then Special Olympics Healthy Athletes, it is basically the health section of Special Olympics, connected to but separate from the sport aspect. And so we have Healthy Athletes is consistent of a bunch of different disciplines, including vision, hearing, we're the health promotion branch, Strong Minds, there's a feet, I can't remember the one for the
Opening
feet.
eyes,
Opening eyes,
special smiles.
Yep, Fit Feet, that's what it is.
Fit Feet.
Yeah. So they host a lot of really great events and have a lot of really great inclusive resources. And I think I skipped Project Carrot, but that deals with a lot of the accessible communication, assistive technology.
Yeah, Project Carrot stands for Coordinating and Assisting the Reuse of Assistive Technology as a part of the Kentucky Appalachian Rural Rehabilitation Network. And so that's individuals that are donating their technologies. It gets refurbished, and there's a whole network of students that are part of PT and OT programs that learn how to clean the equipment and refurbish them and take care of them and get them ready to go back out to the public. So it's a really cool program.
Awesome. All right, so we are at the point, sorry, that picture was linked, where we want to do some reflection on we want you all to do some reflection. So we have these different readiness and our self-assessment rulers where we've given, give you all a minute. I know there's a lot of information to digest and that we threw at you over the past 4 or so hours. But really taking a moment and now assessing kind of where you're at and how inclusion and accessibility can come into the work that you do. So we're going to have 3 different ones, 3 different self-assessments. So the first one is asking on a scale of, is readiness, I'm sorry, my cat just crash landed, is important. So we're going to ask you on a scale of 1 to 5. So with 1 being not important at all and 5 being extremely important, how important is it that you and your organization begin making programs and services more inclusive and accessible? So feel free to share in the chat if you would like. You don't have to, but we'd like to definitely start a conversation. And then when you think about the number that you picked, why did you choose that number? And what would it take to get you to a higher number? What resources and strengths do you have or do you need to increase that importance within your organization? So I'll just give you all a minute to think and share if you feel like it. And while you're still simmering on importance, I want to take that a step further and ask about readiness. So on a scale of 1 to 5, 1 being not ready at all and 5 being extremely ready, how ready is your organization to begin making programs and services more accessible? 5 need to reach out to different communities, absolutely. Think about, what do you, if you're maybe only at a 2, what can you do? What will it take you to increase to a 4? What do you need to do that? Yep. See lots of 5s and 4s for importance. Yep, absolutely. Readiness is about a okay, so importance is at a 5 for this individual and readiness is at a 3. So yep, more planning to do with organizations. Yep. Yep. Yeah, that is awesome. Bringing that lived experience along with that professional experience is so important. Yeah, so thinking about, maybe extremely important to your organization, but you're not necessarily ready. So what are those things that needed to fill the gaps? So we'll take that one step further to confidence. So how confident are you on a scale of 1 to 5 that your organization can actually begin making programs and services more accessible? Seeing some folks, yep, readiness for a 4 because you have some good collaborations with others, but you still have, a little bit of program adaptation to do. Julie, love to see it. We work closely with Julie to create some of the public health resources. Confidence is high, have the resources, just need to take that next step to execute. Absolutely. Deal. And there's really, thanks, Colin. There's really no shame in saying on any of these that you maybe are 1 or 2 or 3, but you took the time to be here today and go through the entire presentation and learn maybe areas to improve. So you're already taking a big step in that direction. So don't be discouraged if you're starting off at a lower number, because that's, we're here to support you along your journey. All right, and in keeping with that, we want to give you all some tangible action steps or things at least to get you started in the right direction. So again, feel free to put these in the chat if you'd like, or just kind of be mindful of these questions and bring them to your team maybe to start these conversations. So, what are some areas in your services and programming that after going through this presentation today that you feel you need to be more inclusive or accessible? So maybe something that we talked about, you were like, oh shoot, we totally don't do that. Like that would be, a great area for us to improve. And then along with an area you might want to improve is what is one tangible step that or your organization can take to be more inclusive and accessible? And then bringing it back to partnership, which we've been talking about the whole time, is what is one organization that you can connect with to assist with these efforts? Again, I'll give you all a minute or 2 to think about it and feel free to share. And maybe you're still figuring this out. Maybe you took in all the information and you need to kind of digest it and take a step back and look at your program and bring these lessons learned to others on your team. Yep, so next step, that's great. Have a team meeting to digest this information and discuss how it all relates to your next steps. Yep. Incorporating more languages, absolutely. Yep, Colin's talking about that certain establishments don't even realize that they're not being accessible. So that is very, very true. That's what we find majority of the time. It's not malicious intent. Folks just don't have the information that they need to do these services accessible way. Accessible cooking and nutrition. Transportation is a big one. These are all great ideas. The key recommendations for a virtual world, absolutely. And we will be sure, like I said, to send that out to you all when it's finalized, which should be very soon. Absolutely. Local resources. Yep. And pointing people into the right resources, like with SNAP benefits, absolutely. Tools, yep. This is a big one, yep, about internet access. That is a huge one that we've run into along the way, absolutely. So we know that we live in a virtual world, but still making things available in physical form is so important, especially the COVID vaccine protocols. I know a lot of people are struggling with the signups because they're all online. Great. Well, feel free to keep going in the chat with thoughts and recommendations. We're going to close with just our contact information if you all want to reach out to us for more, and then we'll open it up for some questions.
And then this is the contact information for NCPAD in general. And we have a hotline. We have an online live chat that's monitored every day, Monday through Friday. So you can contact us that way. We have an email and obviously the website. We want to invite you to check that out. And our UAB Research Collaborative and the other sort of elements of Lakeshore Foundation of where we're based are also linked through our website. So you can check those out as well.
Thanks, Chris. And then our team, we are Wellness for KY across the board. So our email is our UK shared team email, wellness4ky@uky.edu. And then on Facebook, we're Wellness for KY, our website, wellnessforky.org. And then the only thing that's different is our YouTube channel, which we are HDI Health and Wellness on there. And again, we'll send out all these links, so no need to scribble furiously.
I did just put the link to the Wellness for QI in the chat as well, if you want to click it and start poking around.
All right, so before we open it up for questions, we do have an evaluation that we ask. Austin, would you mind dropping it in the chat? I can't copy it from the slides, please. Is we do have an evaluation that is required if you are looking to get continuing education credit, but it is also, even if not, and you're just attending just to get the information, any feedback that you can provide us would be greatly appreciated. So we can continue to improve these trainings and learn what was useful, what wasn't useful. Yeah, so it helps us out a lot. And so Austin, while she's popping that in the chat, we can open it up for questions. I know we've kind of had some questions going in the chat all along, but you have us for another 11 minutes. So anything else, feel free. And we do have the ability, if you do want to speak, you can raise your hand, use the hand raising feature. And as the host, I can unmute you. So if you'd rather talk, then that is fine as well. Inclusion of other disabled persons teaching. Yep, absolutely. That goes back to that nothing about us without us piece. All right, let me see. Someone raised their hand. Let me find you. Okay, you should be unmuted. Go ahead.
Hi, I just figured I could probably explain this better out loud.
Sure.
So I'm curious about how people generally find your programs. The comment I made earlier about internet access is sort of bubbling in my head as well when all of our recruitment materials are online. So do people generally hear it from their providers who have then found it online, or is there more direct outreach?
That's a great question. So, and anybody from Kentucky, if you want to feel free, or NCPAD, but I will just say on our behalf, we really do try to cover a lot of bases, but admittedly, we do more online than in person. But I think, you know, connecting with those organizations like the Centers for Independent Living, and providing those physical resources like printing flyers, like we still print flyers, and anytime we'll go to a lot of community events. Like there's always like there's a lot of cities in Kentucky have special needs expos that we'll attend and have a table at and have information. So yeah, especially, I mean, it's harder obviously in a COVID world, but we do still try to cover those bases of in-person and physical things that we provide.
Thanks.
I would say prior to a year ago, that answer would have been different, Danielle. I mean, we were much more active in person in the communities across the state. We just have not been allowed to do so for the past calendar year. So I think we luckily had enough of an online presence to when we had to shift to focusing on only online, we were able to do so successfully. But we are looking forward to the opportunity to be able to engaging people where they are, because we know the ultimate value of being able to do that.
And from the NICPAD perspective, we are an online resource all the time. So that's our nature. That's what we are. We have a variety of ways that people reach out to us, not the least of which is our chat line and our hotline that I mentioned just a few minutes ago. We do get a lot of phone calls from folks that maybe are looking for something else, but not necessarily the nutrition, physical activity resources that we offer. But that's one way that people find us, I think. We have specific requirements to assist the disability and health programs. And so we work with the 19 states directly as well. And have a number of different partnerships with organizations that maybe have a bit of a larger or wider reach than we do, namely organizations like I said, the National Association of Chronic Disease Directors for state health departments. We work with America Walks. We work with, I'm trying to think of other organizations, but just a variety of somewhat well-known. American Heart Association is another partnership. So we work with somewhat well-known health promotion organizations and kind of get our name out there and actually partner directly with them to focus more on inclusion. We do sort of have that challenge as well of the digital divide and really trying to get to people with disabilities who are, maybe in rural areas or don't have access to broadband. I know that we are trying to, in our research, the UAB Research Collaborative is really trying to do some nationally focused projects, particularly around diabetes and chronic disease prevention, and using things like artificial intelligence, like an Alexa, and how can that help with someone's participation in a diabetes prevention or chronic disease program. So we have a variety of ways that people reach out to us. We're not the biggest program in the world, so we're not always easy to find, but people do find us.
Thanks, Chris. Some folks in the chat saying they got some good info out of this. So I'm glad y'all enjoyed it. And yeah, while folks are saying maybe all of the health concepts don't apply to your exact role, but the general principles you found impactful and educational. So that's awesome. Q&A. Oh, nice. Rebecca, Colin wants to know how he can, if there's a way he can participate in wheelchair rugby.
We can link you up with some of our coaches and see what opportunities are out there. I know. Usually the WR, when we wear the gear, people usually end up leaning towards some type of women's sport, women's rugby or women's rowing, but I guess it's the wheelchair rugby. Fun sport too.
Just want to thank everybody for the positive feedback that you all put in the chat, and we look forward to reading your evaluation results at the survey. This is definitely an extensive training that we've worked collaboratively on over the past several months, and so we're really grateful to hear the positive feedback and that the information was informative and helpful to you all for future directions. And please don't hesitate to reach out to our Kentucky team and NCPAD and letting us support you and the wonderful work that you're doing in the communities.
Thank you all so much.
Thank you.
Enjoy your afternoon.
Thank you, everybody.